Mic check. Mic check. Mic check. Mic check. Mic check. Get from far. Mic check. Mic check. Mic check. Mic check. Eitamu. Okay, let's stream. It's live. But I want you guys first help me with the sound. I'm not really talking. So we can hear it again. Yeah, you guys let's do your conversation with your guys. From your right now it's just the logo showing, but also we don't have any people online yet, so that's a good thing. Piri, 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 piri. See what we do. Don't I come on the video here? I got a music video.
Yeah, I'm part of the major team. I'm a doctor. And over to you.
Hi, Conrad. Okay. So, part of the major team, been here before. I'm happy that you have been looking at what Dr. Clarke has been talking about in our few episodes that we have done so far. Happy to be here. Let's get rolling.
Hi, my name is Dr. Joseph. Happy to be here as a town doctor. Yeah, been following Major for a long time, so happy to be here and be part of the experience today. Yeah, looking forward to it.
Hello, my name is Dr. Joram. I'm a pharmacist. It's my first time here, and I'm really eager to get to know, to learn more from Dr. Joram. Thank you.
Yes, Jonathan Kavunda. I'm a practicing medical doctor. I'm also an entrepreneur. I'm also someone interested in thought leadership and policy a lot, and also patient care enthusiast. So I'm so glad to be here because I'm so interested in how the major series has been running, and I feel inspired already, and I'm really happy that we have even been able to attend and maybe even participate as much as possible. Thank you so much.
Hi everyone, my name is Pauline. I'm a baker. I am happy to be part of Major's journey in this way. I think that the stories that have been told in the series so far honestly apply to more than just doctors. I have had a lot that I have learned, and I hope that can break the doctor boundary so that more people outside the health profession. Yeah.
Thank you.
Yeah.
Alright. Thank you. Yeah, we are going to hear about some people who are putting in their resumes. So everyone knows Ian, and we're here for a Q&A, mostly to have conversations with him, ask him questions, and have him maybe ask us questions, and get some answers from him, some stories, some things beyond the docu-series. Major has come a long journey. We got the idea 3 years ago, in our last month in medical school, and the original idea was to get people exposed to the great things that people are doing in healthcare and the things behind them. You know, when you see a hospital and you walk through it, you're like, okay, maybe one day I want to build a hospital, but there is a lot that goes on, and we wanted to share with people the minds behind that, the stories behind that, so that it can spark some imagination. But now, the idea of Major has evolved, and beyond just sparking imagination, we want to young people to have extraordinary careers, if I should say, just like Ian's career. This has been extraordinary. Yeah. So we hope that this experience gets people asking questions, gets people imagining, and I hope that people following online will also have a similar impact. And if you're joining us online, you can just type in the chat and let us know where you are joining in from. So right now, I think I'll open it up.
Before you open it up,
Okay.
Cece's original idea is, he didn't say talk about the original idea was not actually to have all these people interview. The main idea was to share David's story.
Okay.
So through medical school, he was doing some good work. I think you testify. So he sat down and said, you know, one time I was just having lunch and he decided, you know, we could share stories. And he's like, you know, he wanted to have something, probably a book or something like that. But then the idea came out that he had to be a story. But then you know how selfless he is. Like why should I share my story alone? So that's when we come out with, when we share the other stories, the bigger stories. There's people out there, the champions sometimes of all of them. So yeah, just wanted to emphasize.
Okay, Conan has reported me. So Conan is the team leader of Major. My headmaster. Okay, yeah, so I wanted to keep it brief, but you guys want to know more.
Like I say, it's selfless.
So through, I'll just add something. Through medical school, I did some things that I think are really incredible. There were 6 years for us because of COVID, but in those 6 years, I left with a degree in medicine and surgery. But I also left with lots of things that I'd done. I started an initiative, Kamuga was part of my team, that is working on patient-centered care. Over 1,000 students across the continent in 19 universities. Sounds brief, like in seconds, but that was really hard work. Yeah. And it's going on right now. We have a new cohort of people, and beyond that, we started an AI company that I hope we're going to push forward to have a first class soon. I did a lot of things, worked with the African Union, worked with the UN, and I felt I'm not so unique. I think anyone can do the things that I did in medical school, and where I credited it to the exposure that I had. I had the privilege of traveling across the continent. In first year, I went to Nigeria, and I still speak about that experience. Like it's one of the things that opened me up. You know, as like first year medical school, I go to Nigeria and I see these young guys with NGOs. You can imagine, like you come from Bara and then you meet guys who are in third year of medical school and have NGOs and they have startups and they're talking about papers they've published and talking about how they are at a conference in Kigali. So for me, medical school was formed from that, and I hoped that I know there are some people who just don't get to have those exposures. Maybe they can't afford, but I know there are many who can afford, but the idea just doesn't come up for them. So I hope that what Major does is one, share with people who can have those experiences, but also spark it in some people who can afford but are just like behind their phones and maybe just run around Kampala and Uganda. Yeah. So that's the longer version behind Major. But now we are here with Ian. Maybe we should start with Ian telling us anything you would love to tell us, and the question starts. Yeah.
Well, follow that. You have a signboard that says somebody creating the future, isn't it?
Yeah, that's the theme.
Yeah. And I was thinking, well, I'm the past and you're the future. How you guys run the future? Whereas, I'm the past in the sense that we're looking back at stuff that I've done. I hope to still do more things in the future. And the season that I'm in is very, very good for me to be able to share and mentor and encourage young people. There's two things that occurred to me from your story, David, and from my own experience as well. The first one, I don't know how to summarize it, but it's like you decided to just get out there and do it. You know, I don't know how you ended up in Nigeria in your first year, but I got the opportunity to go to Nigeria when remember I was in politics?
Yeah.
I was there. So there was this conference came up and they said, no, the mayor has to attend. Anyway, I can't remember the circumstances, but I really at the last minute, I said, I don't really have time to go to this. So I said to the deputy mayor, you can attend. And she was like, great. So she went to Nigeria. And then a couple of weeks later, when she got back, I said, so how was the trip to Nigeria? She said, it was fine, except that they had cancelled the conference. She said, oh, what the way there? No conference. Just a minute. If that happened to me, I would be so mad. But anyway, like, Nigeria is not the easiest place to, as your first trip, not the easiest place to go to.
It was not really easy. It was hard. By then, we used to junior had hotels by then. So I booked my first hotel in Lagos with junior, and I arrived and they didn't have a room for me. There were things playing out. I had to go down to Uganda. As looking back as we did there, it was like 19, flying out alone, and then like, it was fun, and still things that are.
But that's I think the first thing people do is just get a passport. Like because if you get the opportunity to do something, then you start applying for a passport. It takes forever. So I think there's certain things. What does it say is that good fortune favors the prepared. Yeah. What strikes me about you, David, is that you think this I can do this, and then you take steps. And if you read the Atomic Habits, that book, it's well known. And I think it's not that it says that if you want to do something, just take some step. If for example, you want to start doing jogging or physical exercise, then put on your shoes. Start putting on your kit. You're more likely to go out. So I think it's that willingness to put yourself out there, which requires courage. And I think that's the first thing that David is the sort of guy who's prepared to put himself out there. I don't know the rest of you, maybe like that as well. You're a baker, you said? What's your experience? Did you start the business?
Yes, last year.
How was it?
It was scary. Yeah, it was scary because I did not know if I would get customers. But I realized that people will do it for the product if you're going to enjoy the time with it. And that's what has happened so far.
Yeah. There's one of my experiences has been, I think I said it in some other podcast or something, most of the people I went to school with, it was about 190 here in Belfast in Queen's University. And the vast majority of them really stayed around Ireland or the UK. There's only actually a few people. It used to be, before that, people would have, you'd have had medical school 100 and half of them were in America or they'd gone off all around the world. Now you're allowed people to stay around. And I think actually going into a new situation definitely requires courage. And that it's what I call getting out of your comfort zone. So I think being in your comfort zone at any stage of your life. And we like comfort zones. I like my comfort zone. So being able to break out of your comfort zone, I think, is extremely important. Now, the other thing that you will discover as you go through, discover in your business and the bakery as well, that you need, and I've really been aware of this in every business that I've done, you need grit. Any of you ever read that book called Grit? Is it a business officer now? Yeah?
That's
That's the one. She's a lecturer at some university. I think grit is but she was good in that she summed it up in that book, and she also then almost quantified it in terms of, it's a valuable characteristic, it's a valuable part of your character. So if I think of all the businesses, the few businesses that I've done, all of them required grit. There was a period in all of the businesses that I've done which was, I would call it grinding. It was like tough. And if you don't have, if you're a quitter, like there's times when you have to quit. There are times when you have to say, like you fail. In life, that's part of it. And you learn through failures as well. But there's also times when you have to just carry the responsibility. It's not exciting. It's grinding. It's hard work. But you just got to go through that period to get to the end. And I've had that all my life. I think my dad died when I was 9. And we were brought up on a farm. I had one younger brother. He was almost 4 or 5 years younger than me. And then 2 older sisters. So I found myself in that I was the 3rd child. So the 2 older sisters didn't do much on the farm. Girls. My younger brother was too young, so when I was 15, he was like, if he was 5 years younger, 4 or 5 years younger. And I think I found myself working with my mother to run. It was mainly chickens that we had. So you were feeding the chickens, watering the chickens, blah, 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 this sort of stuff. And I think that did develop in me maybe a work ethic, okay, but I think it also developed that characteristic of being able to persevere. And I still jog, and I'm really the oldest. I'm the oldest jogger I know. There's a few people that jog at my age, and I get slower and slower. But when this hill, you come up that hill. Well, I jogged up that hill this morning, and I've already jogged around. And sometimes when you're doing something like jogging up a hill and you're tired, you just want to stop. But you keep going. You say to the next telegraph pole, the next entrance. I'm near the top. Just keep going until I get to the top. To me, that personifies grit in a way, and I think that endurance, that ability to keep going, it's a mindset thing, and I think that it's an extremely important characteristic which not everybody has. Some people they give up. So I'm not saying that you should persist through every difficulty when a business is failing, and so you have to know when to make that judgment to quit. But I do think that every business that has a leader, the leader is the person who bears the responsibility. And that weight rests on their shoulders. And to be quite honest with you, in a business and a family, it's the same if you're in the head of a family. If you're going through hard times, a lot of people, they don't want to know. They want, I just need my salary. So if there's sacrifices to be made, you've got to make them, and don't whinge about it. You started the business, or you're the leader of the business, and you've got to be the guy to carry it. And sometimes the guy or the girl to carry it through also has to grin or smile and not even tell people how tough it is, because they need the encouragement. If you crumble, it all falls out. Yeah. So those 2 things, I think, are that ability to get out of your comfort zone and do something, and then that ability when just to persist through to make sure something. Yeah. Anyway, we've lost it. He's back. We're lost with that.
Okay. Yeah. So, all right. We have given you guys bookmarks. You can send one to Ian. These bookmarks have a quote and a question. So you have all picked random ones, and so you are going to have an opportunity to read the quote and the question. There are 2, so you have to choose one, which question you want to answer, and then in regards with that, you can ask Ian a question. With, starting from one of us two. Yeah, they're bookmarks. So one of the things that I really think are great for people who want to create the future, which is the theme of the work we are doing, is that you have to read books. You have to teach yourself a lot of things. Books and traveling are really, I think, at the center of education, books and traveling. So these bookmarks, I hope, get you guys reading more books. And then I hope you take a copy of Ian's book. All right, so we shall start from Sachito. You can choose one, and then there's a question, and you only have to answer it. You had to pick, yeah, we can pick another one.
Let me take this one. Every remarkable journey begins with a compelling story. It's not about having all the answers. Just the courage to begin your story could be the spark that ignites change. That's a quote. Yes, let's quote. Then identify one bold step you've been hesitant to take. What will you do before the end of the day to start it? Well, there are many things. I think I've always wanted to start going to a gym. I think I scouted, okay, this week I scouted some of the gyms around where I stay, so I went there once. I hope I go back. I hope I go back. Yeah, but I'll go back before today ends. That could be one of the steps I'll take. Yeah. What about tomorrow and next week? What does a better healthcare future look like? And what's your role in shaping it? Sketch out
Yeah, I think you can just answer
one sentence.
Yeah.
Yeah.
Okay, tomorrow and next week.
Yeah, tomorrow.
Like what way you're going to go to the gym tomorrow and
Yeah,
next week?
tomorrow as well.
That sounds good. That sounds good. That sounds good. Yeah.
Okay, this one says, small, smart moves compound into big impact. Entrepreneurship is not always about giant leaps. It's often about daily intention and action. What habit or action could you commit to this month that moves you forward? Commit to 15 minutes daily. We are saying reading, cold calls, prototype sketching. Mark it on your calendar for every weekday this week. Actually, I began one because actually I said I'm a pharmacist. I began practicing finished internship last year in August. So then did the paper, officially got my papers around November. So and now we began looking for jobs. So after some time we find out the market is a little bit hard. They ask for experience. They say master is an added advantage. So I decided to add on data analysis, and I began this month. So I've used May, I've done Excel. Currently I'm doing SQL. Hopefully, within like 2 months, I would have completed that beginner training.
It's great. It's great. I don't know if you want to add any words on what they're saying.
No, I think it's good. We're actually talking about earlier, the good fortune favors those who are prepared. I think that, yeah, what you're doing is the right thing to do. By the way, I just started going to the gym. I think I'm in my second month now. Because I've jogged, but I always went into the gym, and then the only machine I knew how to use was the running machine. I didn't know how to use all those, they look like sort of machines of torture of some sort. But then I went to this gym, there's a gym just down here called Cash, and they have these guys you can just, give them 100,000 and they'll show you, they'll take you through machines of torture. It's been really good. It's been good.
There's a gym there's a gym on is it Kirupati Mall? Kirupati Mazina Mall. The basement has like the whole basement is full of like gyms. So from Sunday you can walk there. It's a good one. We're going to you guys. So it's a question, and then the last thing is like a challenge that you can choose to do, but you can just read the quote and the question, and then one of the two.
Yeah, Okay, so the baton is now in your hands. You've seen what others have built. Now it's your turn to imagine, create, and lead. The next chapter of health innovation will give you resources, quote. Then the question underneath, what first step are you willing to take towards the future you want to build? Okay, yeah, so my answer, let me first say the future I want to build. Right from medical school, personally, one of the reasons why I actually joined medical school was because I'm passionate about accessible and basically accessible patient care. Now, one of the experiences also I was able to build out through medical school, through generally, I noticed that the biggest challenge in Uganda when it comes to health is not even the availability of the healthcare workers, but I feel like it's more about the resources. Like, we would even be in Monagua, even as medical students, there are things we would be able to do, but to find an MA patient is a certain procedure that you could do, but probably maybe a certain requirement, a tool or something is missing, and you have to send them out to buy it, and maybe they don't have the money. So every day on a ward round, the doctors skip that patient because they haven't done an investigation or haven't bought that tool, and you feel like getting money out of pocket, but then the doctors will tell us not to give patients money to afford things or not to help them that way because you can't keep it up. So it's something that as a person it got to me. So when we finished medical school, it's one of the things that pushed me towards health supplies because I noted that most of these things that are supplied in hospitals are not like so costly compared to the cost of maybe, the retail costs that patients buy them at. And that's what has led me to medical supplies. So in 2023 with a colleague, we were able to start a medical supplies business. And it's been running now 2 years. This is like our second year. Yes, we shall probably make second years officially in July. And why I say that this is one of the steps that I've taken towards building that future, because I feel like as this expands and we get to understand the markets more, we shall now understand how we can provide, let me say cheaper, but quality products to the market, and in a way also help prop up private health care, because one of the challenges why also patients face that challenge that they cannot afford private health care. Why private health care is also expensive because the hospitals and the medical centers will also tell you their supply chain is costly. So they sometimes transfer the cost towards the patient. So that's the angle so far that I'm approaching, and maybe this is something that will come later, but it will be a question towards you, Dr. Ian, how you are able to figure out pricing in the hospital, because as a person, one of the things that I've always looked at has always been pricing. People look at health as, let me call it a human right, like good access to good health or good healthcare services, like as a human right. So how does, if a patient comes to me and I have the service that can make their life better, how do I price it in a way that I'm not extorting the patient, but also in a way that I can also survive, like that element of pricing a service like that. Yeah, thank you.
Wow. Are you supplying your stuff to patients or to hospitals or
both? Yeah, both.
How do patients get to know that?
Now, most times with patients, it's usually referral through my colleagues. Since I'm also a practicing doctor, I have friends who are also working in different institutions in Kampala and beyond. So they sometimes send when maybe a client needs like an accessory, like a wheelchair, like maybe a pair of crutches, things that are usually not given as per hospital services, maybe a BP machine, and then they can come to me. But then also hospitals, through some of my friends that are working there, sometimes they can be like, oh, we need maybe this machine or this, and then you come to something like that.
Well, one of the things about healthcare is that it is like, as you say, like a human right, and it's a humanitarian thing as well. But somebody's also always got to pay for it. It's either going to be government to pay for it, the individual to pay for it. I think the most equitable way is some form of insurance, and I think that can be done. It can be done even in poor countries, but a lot of the mentality of insurance, even for people who can afford it, people here like to pay for something that they physically receive.
Yes.
Either the service they sit by the doctor and get the consultation, but even with that, you'll find patients who this is why you have to have pay points in private hospitals, because if somebody goes in and sees the doctor and doesn't get some medication, they'll probably just leave, and they don't feel they have to pay for the doctor's time and all that training the doctor did. So there's a mentality that if you don't receive something, you don't pay for it, and yet in basic economics, if you take private health insurance in this country, which which for the vast majority of the population is much too expensive. The person in the village who is just living in a subsistence level, but it is definitely affordable, lower middle class and beyond, and yet you find that the insurance penetration is actually quite low. I think medical insurance now is going to cost, if it's part of a scheme, a group, it's going to cost 800,000. Let's call it 800,000 to $1 million. Now, now people say, oh, that's quite expensive, but you compute that down to 365 days a year, and how much it is per day is not very much. It's what is that? That's actually 3,000 a day. If it was $1 million shillings, it's something like 3,000 a day. Now, what do you spend 3,000 a day on?
Taking the board.
A
Yeah,
boda,
probably
a
a
cup of
boda.
coffee,
Yeah.
maybe a coffee,
Or
maybe a snack.
yeah. Or data, internet.
Yeah, internet.
Yeah, yeah. So, do you not think that, when we use our heads, the first thing that everybody should do is go and buy medical insurance? Because the pooling of resources and the way that thing works there, if you do have your boat accident and you end up in extremis, it's covered. Essentially, I mean, the private medical insurance, the issue I have with private medical insurance here is people use it on trivial stuff. So people get that insurance, and often the reason they have it is because they're employed by a bank or a corporate organisation, so they get this free cover. And the first thing they do is like, oh, I have a headache, and then they take their little card and they go to the doctor. And what happens then is the clinic will bill on an average of 100,000 shillings, yeah? And yet they could have waited a bit, taken a paracetamol, and what normally would happen is that medical insurance in more sophisticated countries just covers the catastrophic stuff. It covers the accident, the emergency, the person who finds himself, with a dread disease and so on, and it doesn't cover the casual attendance. Like in Ireland, they don't have medical insurance, but they have like a national health insurance. But when I go to see my doctor in Ireland, I usually treat myself actually. It's about, just the visit is about at least 60 euros. 60 euros. How much is that? It's about 300,000 Uganda shillings just for the visit, then plus your medication and stuff like that. But when you go into hospital, because you didn't choose really to go into hospital, I fell off a horse, ended up in hospital, and it only cost me about 100 euros or something. So to me that's the right way. You should not encourage people to go for the small things. We've got it backwards here. So that, to me, somebody has to pay, and we need to look at the finances of the system as opposed to then the humanitarian part, which would be sorted out if we sort out our system. But well done for what you're doing.
Thank you.
Failure is not the end, it's part of the blueprint. Entrepreneurs learn, adapt, and grow through every misstep. The question is not if, but how you grow from it. What past failure are you ready to learn from in a new way? Pick one past setback, extract one lesson, and write down the tangible change you'll make best on it before next Monday. So one of my biggest challenges has been changing my perspective on failure and choosing not to wallow every time I'm faced with a difficult situation. It has been, honestly, the most enlightening thing to choose to see failure a different way. Because then you don't waste time in the spilled milk. You get up and you move on and you're saying, okay, what next? What do we do? And then it also allows you to strategize more innovative ways to deal with now the new situation, because you hadn't anticipated the new situation. So one failure I've dealt with, that I've learned from as a baker, is baking when I'm tired. I've learned that baking is chemistry because it's like a set of ingredients enabled by a particular environment over particular time frames. And if you get it wrong, then the product is not going to be the same. And the number of times I have baked when I am exhausted, it
hasn't worked out.
Oh dear.
It has always fallen apart. Yes, the chemistry has failed. Because I guess also maybe the mental bandwidth to be present is just not there because I'm so exhausted. But I have learned that if I am to give my clients the best service and the best product, they deserve better than a tired baker. So I have to rest. I have to find time to recharge, and resting may not only mean sleeping, it could also mean taking a walk, it could also mean disconnecting from my phone maybe for a day or a few hours. It could come in all sorts of ways, but somehow it all weaves little by little into being able to give a better service. Yeah, because then mentally I'm present when I'm doing the baking. Yeah. So my failure has been when I'm tired, it hasn't worked out. Yeah.
Yeah. No, I think that's good. I've learned from that as well. Sometimes when I'm really stressed, then I would exercise, and that will take off the stress, because exercise what is exercise release? Endorphins, isn't it?
Yeah, endorphins, all the happy hormones.
So sometimes it's funny thing, when you're really stressed, it's not the best thing isn't to sort of just like collapse in front of the TV. It may be to do some exercise or something like that, and then be stressed. But you're right, if you're tired, it won't be productive.
Okay, I think we've had some people join us. We introduced ourselves, so I think they should introduce themselves. You get to know them, and then everyone has a card. It has a quote and a question. So you read the quote, and then the question is for you to answer. And then if you have a question for Ian, you give it to him. And then we shall go back to the Q&A. We start from Bella.
Okay. Hi, my name is Bella Twine. I am a journalist by profession. I support Major with media ideas for now. And it's very great to meet you. I've read some of your work in newspapers, and it's very amazing. This card says, thinking like a founder means acting with vision, resilience, and responsibility. It means seeing opportunity where others see obstacles. It means starting now. If you approach today like a founder, what would you do differently? I know you're a founder of a lot of things. I think if this question was directed to me, I would think maybe I would solve more problems than create them. Yeah. And also see a solution in everything, because there's a lot of problems in the world. There's a lot of problems in our communities, and as Ugandans, most times, you hit a pothole and you say, "Oh my God," you blame. Yeah, you blame a lot of things and a lot of people, and maybe there's something you could do about it. Maybe there's someone doing something about it, and maybe we should be highlighting that person or focusing on that person. Even in the medical field, there's a lot of people doing amazing things, and yet we have quite a number of problems that we want to solve in that field. And most times, as a journalist, most of my work is in the NGO sector, so I'm not really into knowing what the medical field is having currently as what's up to date. And most times when you ask people, when do you think of a doctor, or when do you think of a medical personnel or a pharmacist, and they'll say only when probably I read the news, or probably only when I'm sick. That's when I think of the topic of medicine. Otherwise, I just go about my day and I don't think about the medical world like that. But I think this is a very beautiful initiative. But also, one question that I would have for you, Ian, is watching the Medjo series. I saw how you got into Uganda, the problems you found, and it was far from the routine that you had in Ireland. So when you came here, you found problems and you wanted to tackle them. How would you urge young people, especially those who are not employed in the sense, to find opportunity in the problems?
Yeah, it's interesting. What you've said was, you could say another way to say it was better to be optimistic than pessimistic. You know, so you can go around and be really annoyed by all the potholes and frustrated by everything and stressed. Which, by the way, I do get stressed and frustrated and that. But I do tend to also have an optimistic personality in the sense that there's something you can do. There's always somewhere you can start. I feel, there's always a little thing you can do, and I think that was illustrated also by David's story as well. So you need to look for this guy who's a pharmacist beside you. He's done his internship to look for a job, but now he's actually doing some trainings and some computer courses and stuff like that. And I think that person can wring their hands and say, I don't have a job, or they can do, I think it's a biblical quote, do what thy hand finds to do. Now, there's a lot of people talk about, follow your passion and stuff, but we don't always have the privilege of following our passion. We often have to do the stuff that will bring some money in the door. But I think that you'll never, a journey's dynamic. The car, if you're driving a car down a road at night and you just sit there, you're not going to know what's ahead until you start going, and then you shine your lights and things come up. And I've been much more of a doer than a thinker. I think I need to think more. I think it's also a fault when you just start doing stuff and then maybe if you sat down and planned better, you could be more productive. But often in our own lives, we do need to take the next step, and I think that's psychologically that's better. But then I would also say that a lot of the good stuff that's happening in the world is also a group of people get together to solve a problem or to think something out. And they saying two heads are better than one, but I think a few people together. And if you listen to some of the venture capitalists now who have had a lot of experience of being very successful entrepreneurs, they look at the people, they look at the group that's together, and they so there's not so many Einsteins. I mean, Gillett might be an Einstein, but I'm certainly not an Einstein. And I think groups work well, and if you can get the group with the right chemistry, that really can take you places as well.
Yeah, I just want to open it up. It's in case you want to chip in, you can just see and then you're allowed to chip in.
Yes. Hello everyone. Hi. My name is Cecilia Lonyo, and I have a background in public health. I have a bachelor's in public health, but right now I'm into climate change and health and trying to make sure that gap is bridged a little bit. And with that, I'm working with Ministry of Water and Environment in the climate change department. I'm an officer there. So, Dr. Clarke, I've read, growing up, I've really seen you in the newspapers, and I've never had the opportunity to meet you in person, and this is an honor and really a privilege.
And I'm sure you thought I was a very old man.
Yeah, a little bit,
90
yes.
years old.
Yes, a little bit. And I used to ask myself, why does this Muzungu, struggle to fight for the health of Ugandans, and they were always in the news and the TV.
He's a Ugandan.
He's a Ugandan. And it was really just amazing watching your career on media, and this is just really an honor to be in your presence and have these discussions with you about medicine and about
You see if my wife heard you, she's upstairs, she'd be like going, I'm going to throw up. Big head.
Yeah, so I'm just really happy to be here and just listen to everyone and just share with everyone here. My card
strategy twins intentions into impacts. Without it, even the best ideas fade. With it, you can build something that can last, that can outlast you. What one strategic move would you commit to this month to drive your impact? So really, Dr. Ian and everyone, my biggest struggle has been consistency. I think I have a lot of ideas that just pop up, and think following through and just making sure this idea is grounded and building it up into this amazing thing. I've struggled with consistency. So maybe this what I want to commit to this month is consistency. And my question to you, and maybe anyone in the room, what has been your motivation to stay consistent in this, in all, especially the things that you've built up in Uganda? Yes, consistency.
What has been your achievement?
What has been your drive to be, consistent in what you do and just continue to do as you did?
You know what, we talked about that before you came in. I was saying that, and I'll repeat it because I think it bears repeating. I was saying that one of the characteristics that can stand as entrepreneurs or people who are taking responsibility, it's grit. There's a book, Angela Duckworth has written a book called Grit, which I thought summed it up. It just really resonated with me. Grit is that ability to keep going and to sometimes just be smiling through it, but it's really not easy. But you just keep going. And I think when you say about consistency, I think you learn grit through discipline. I always tell my children, actually, and they're old enough now, but what we want in life, we want small acts of kindness and small acts of self-discipline. Those two things go hand in hand. It's not always easy when you're, well, a lot of you don't have cars, but when you're at the roundabout and you see the guy this guy has this terrible little child that he wheels around, and actually the last time I confronted him, I said, what are you doing here, because I wasn't sure he was just making money, because the child was so pathetic. But sometimes a small act of kindness may be to give money to the beggar. I'm not saying it is, and especially some of the street children, it's just, it's not a good cycle. But sometimes when you see someone who's less fortunate than yourself, that you can't maybe change their situation, but you can maybe do something. There's very many small acts of kindness that you can do. You can do it to your friends, you can do it to strangers, you can do it, and I'm not, I don't think I'm a naturally kind person. You know what I mean? No, really, what I mean by that is, there are people I know and they're just kind-hearted. They're just like those lovely people, you know what I mean? I think I have to tell myself, don't be hard. Anyway, so I think the small acts of kindness, by the way, it can be just greeting someone. It can be just, smiling at someone. And then the small acts of self-discipline, that's what builds grit, right? I mean, I was given the example of running up this road, which I will boast that I ran up this morning at this hill. And I found it really hard. If I've been out running, and I'm like, as I've run more, I've got worse at running. As I've got older, slower, and I get to the bottom of the hill, and I have to sit down and rest and all that. So sometimes I can run up the hill, sometimes I can walk up the hill, sometimes I can do halfway up. But it's like each step, so I'll just get to this lamppost, I'll just get to this driveway. And I think that's about consistency as well. You build it. You build the muscle. You build the mental strength or something. Yeah. And so you just have to do it small, and it'll be good over time. Somebody's next. Who hasn't done it?
Hi everyone. Hi. I am very happy to be here and to finally sit in the same room with Dr. Ian Clarke. My name is Rogers Chiyonga. I am a medical lab scientist and as well as an M&E specialist. But right now, I'm not practicing diagnosis. business, and it's something I got interested in and decided to invest in. I've been reading a lot in that column in the newspapers. Every time I would buy newspapers, I would actually find that there's a column for Dr. Ian Clarke, and I would always get interested in reading about it, and then getting to learn how someone can even make it when it comes to entrepreneurship in the healthcare sector. And I'm also happy that I worked with IMG. It's the organization that employed me first, straight out of campus, and I know right now they've transitioned to CCare, but by the time I joined and worked, it was under your management. My card today reads, innovation begins when we dare to question the way things are. In healthcare, that courage can save lives, shift systems, and set new standards. What broken system, all unmet needs, are you uniquely positioned to challenge? Identify one sacred cow in your field, draft 3 alternative approaches, and test one this week. I like things to do with innovation, and in my previous work environment, I used to work in a research organization, and we were dealing specifically with TB and HIV. And we used to work with underprivileged communities, and we used to call TB a social disease. Like many of the reason as to why many people actually get the TB is because of their social backgrounds and how they live. So we used to go to these slums, and I got to know about very many slums around Kampala, Kisugu, Namuongo, Kasa, very many. And I got to learn that many people actually that come presenting with TB, some of them actually have been previously affected by the same disease. But then our healthcare system does not care to ask and devise means of tackling the reoccurrence of this disease. So we're working on a certain trait of the TB, which is the trace TB. Many people get to know about TB as you can be MTB negative, low, high, very high, but then there's this unique result of the trace. So many times it's not true TB, but rather sometimes it's the DNA that remains of someone who has been previously treated. And then it beats my understanding as to why many times these people come back to the facilities and then they are treated again without many times doing further investigations of whether it is actually a new disease. Is it TB, or is it just the remainder from the previous infection? So in that research that we are doing, we actually found out that the biggest number of people that actually had the trace TB result are people that have been previously treated, and this is actually not necessarily a new infection of TB. But then, because of the guidelines that are in place, if someone has a trace TB result and they're HIV positive, you go ahead and treat, regardless of whether you've done further investigation or not. So I was working with a small team, and we're actually still working on it. So we're developing a predictive tool. Now that tool looks at the social demographic data of this person that is coming, history of TB treatment, and then the presenting symptoms. So from that, we would have a predictive score. If someone, from the questions that we're asking, each question has a mark. So if I ask the age, where this person is coming from, and then I come to the social habits, are you a smoker? Do you drink? Then have you been previously treated? Then things to do with the meals that they have, and then have you been in prison? So we had a set of around 12 questions, and then out of 100% would score this person, just to be sure if from the score, can we actually tell that probably this person is now getting the TB again, or can we refer this person for further investigation, just to be sure if it's a new infection. So that's something we are still working on, and from the few people that we've tested it with, especially when it comes to understanding their social demographic characteristics, because they're very good predictors of TB infection. So we found out that if we refine it more, and then tailor it to the populations, and then the risk groups, this is one tool that can actually help when it comes to, when you go to health facilities. We have the TB clinics, and we have the peer educators and what have you. And this is a tool that these people can work with, because it's basically asking a question and then you score. So I believe when we refine that, it can be able to help when it comes to identifying new infection with TB, and then helping these communities to actually overcome the reoccurrence of TB. Now, my question to Dr. Ian Clarke, I've always wanted to ask this question. You see, when we are growing up, we always say education. They used to say education is the key. But over time, things look a little bit changed, and we always wanted to pursue. There were like 3 professions out there when we were growing up. You either be a doctor, an engineer, or a lawyer. Thank you. So, so I wanted to ask. See, I have my degree. I've practiced medicine, but then things are not, because these days everyone wants money. You have to have a good life, much as it's a noble profession. You have to serve people, but then at the end of the day, what do you return home to? How is your life? Do you have access to money? If you woke up one time and you're bedridden as a doctor, do you have the funds to take care of yourself? So I wanted to ask, at what point, if I'm a professional, I'm practicing the medicine and money is not coming in, but I have some other talents, at what point do I decide to actually switch career? And what are some of those things I can look at and I say, you know what, I think maybe we can pursue this instead of what I studied.
So I'm of the belief that none of the experience that you get in the education you get should go to waste, and that so if you've trained in medicine, as you say, you feel like you're not being a success, then your question is at what point do you decide to sort of switch careers. You may not even need to switch careers, but you can build on what you've already learned, whether it's medicine or pharmacy or engineering or whatever. It's not like you go like, oh, I've done 6 years in this, now this is rubbish, I scrap this, because it will come in just. I want to ask you, you said you're a baker. Did you do a training as a baker, or what did you train as?
No, my undergraduate is in civil and environmental engineering.
Civil and environmental engineering, yeah.
And I practice as an investment banker.
And you're an investment banker?
Yeah.
You still do that, or do you?
I still do that.
Yeah. Interesting. So you do investment banking and baking?
Yes.
So which is the business?
The baking.
Baking is the business, and the investment banking is
the employment.
Employment, but you get money from the investment banking.
Yes.
But, you see there are certain careers that don't exactly seem to fit, be a good fit. I would say being a baker and an investment banker.
But maybe I could supplement. The beauty about the courses that we studied is that I think that it's less about what you studied and how you studied it. There are all these technical skills that you just have to adopt in order to excel in the environments that our education systems have created. So someone may not see where the intersection is, but for you, you have like a set of technical skills in your head, maybe to do, I'm sure your data analysis. Your data analysis may be making sense to you simply because of the rigorous background you've had as a medical student. For someone who did not come from that history, data analysis may take a bit longer for them to catch up on. Yeah. So there is an intersection with everything, and it can be difficult to get other people to see that intersection. But if you see where your talents and your educational background meet in the middle, then you'll have a very unique skill set that no one else in the market can offer, simply because you're willing to see how those two worlds merge, as opposed to looking at them as two completely different sets of things. Yeah.
So, she's answered the question, and in fact very well, because I think that there's no education that you get that ever goes to waste, that should ever go to waste. But there are things that don't seem to fit together, but they can we do. From my own experience, I grew up on a farm. Father died when I was 9. I was learning to do stuff on the farm from a very young age because it was my mother and myself who really ran it. I was this sort of, there were 2 girls and 2 boys. The 2 girls, I'm sorry to be sexist about that, but they were useless on the farm. I was the oldest boy, and my younger brother was like 5 years younger than me, so it was really me and my mother who ran it. And I really learned a lot of stuff on that just by doing, and yeah. And I don't know what you know, your work ethic, the problem solving. I think a lot of stuff that I wouldn't have even been able to know because I didn't have a father, so I didn't have somebody mentoring me. But I did have a neighbour who was a farmer who helped. Then when I qualified in medicine, I got married halfway through medicine, and by the time I qualified, I was on my, I think we had one, no, when we qualified, my wife was pregnant, that was it. And then we had another child, you know, quite quickly. I was under a bit of financial strain, and I was supposed to do, I wanted to do surgery. That was the sort of branch of medicine I wanted to go into. And to do that, I had to do my primary, which was anatomy. And I really, really, really didn't settle to studying. You know, I was too much doing locums to make some money and all this sort of stuff. And I dropped out of that. I was also highly involved with church as well. And yeah, and I started, and then I got a job quite easily in those days as a family doctor. And I was making good money, and I was bored to tears. And so I started a business, and the business grew really rapidly. But it was a retail business. I was selling furniture, household stuff. You know, I was delivering babies and delivering furniture. It was completely wrong. You know, there was nothing. And honestly, at that time, I felt a failure. But it's interesting how things, you know, you can often you see it retrospectively, you don't see it at the time. The business was failing. I overtraded, and what do you say about learning from failures and stuff like that? I overtraded, and I had to slim down the business to make I didn't have enough money to buy stock for the furniture. I had a bunch of retail shops. I slimmed it down to one big retail shop in the centre of the city, and that was hard. And that's when I really went through a lot of grind, that grit and grind, and you know, I was married with a young family, but they never saw me because I was either doing medicine or even in the evenings I was trying to restructure the business. But that experience led me to really question my whole life. You know, what was this about? Because I was working every hour of the day. I was a good Christian, and I was just like, so what? You know, all I'm doing is saving myself, you know, and my family. I'm not doing anything different than anybody would do. So, but Christianity, you're supposed to have a bigger impact, and that was really the reason that I came for a visit to Uganda, and then ended up coming here. And all the business, I had started my brother in the business, and then he started his own business, and you know, when I came to Uganda, he actually bought my business off me, and those business issues got solved. When I look back, I think it was only a period of about 2 years in which I really went through the middle of all that stuff. So now here's where I'm saying things come together. When I went to Luaro, there was no. I'd gone to the London School. No, I'd done tropical medicine in Liverpool, and of course, there was the barefoot doctor, you know, the primary health care, all of that sort of stuff. And so I went out to Luaro to do essentially primary health care. But you can't do primary health care if you don't have a referral system. You know, like primary health care is about picking up risk factors and then directing them in the right way. And you'd be like, somebody was in obstructed labour. Okay, let's send them to maternity ward. There's no maternity ward. So I had to build a maternity ward. And I would end up taking these people into Kampala in the middle of the night. It was a long time before you guys were born. But then is the various skills that I had got in the course of this business that I that had almost failed, came into play. Just being able to organize people, to organize myself, the skills that I picked up as a boy, on the farm, and I actually found I was good, all that stuff. So your investment banking, your baking, you don't know when everything sort of comes together. And I sort of feel like our lives are like building blocks, and then you have one block, and then another block, and then you start to build up, and it comes to something. And then many years later, when I'm as old as I am now, and I've done a bunch of stuff, people go like, oh, we really admire what you've done, but at the time, at the time you're just like in it into your ears and your eyes and stuff. When we built Joka Hospital, we didn't have any bricks. I mean, this was just after the war, and the Reverend said there was a little guy called Livingston Balaghan who was absolutely a brilliant health worker, and he used to baptize the babies and immunize them at the same time. Really had, we'd line up all the syringes and then stick them, and then he'd put on a circus and then he'd baptize them. But he said there's blocks that there were houses that were destroyed during the war, and there's sort of these destroyed houses. There's some cement blocks, and I found myself with this old Land Rover and a little trailer, trying to load cement blocks onto it, and then different things would happen. The Land Rover would break down or run out of fuel, or you get back in the cement blocks which had been in one piece when you started were all now like gravel. They all vibrated so much they all fell apart. And in the midst of that sort of stuff, you're kind of like, what am I doing? On a rainy morning, in somewhere where you're stuck with an old Land Rover in the middle of somewhere in Luero, and you're just trying to get some blocks to build a maternity ward or something. You're kind of like, what am I doing? You don't see the big picture of it. So anyway, you just sort of keep going. I don't think I answered any questions.
The answer. No, you can ask. Who did get an answer? Who didn't get an answer? Well, you answered. Okay, that's good. Has everyone introduced themselves? Okay. That's good. Kabunga, did you get your answer for pricing?
Yeah, we went into, I think the way
Can you
Dr.
yeah,
the way Dr. Ian explained it to me, because for me the approach, the angle that I view the problem with, I'm looking at it in a way that, okay, a patient is poor, they cannot afford a service, and I'm looking at the point whereby maybe the healthcare provider reduces maybe the cost to enable the patient afford the service. But then Dr. Ian explained it this way, that instead of looking at the healthcare provider reducing the cost of the service, we could look into finding other ways of financing the healthcare provider to be able to provide that service to this patient either for free when some other scheme is providing the financing to the healthcare provider, or this patient may not be able to afford that service then, but if that patient can pay a small amount of money every now and then across a long period of time, when they are okay, when they get into trouble, they have some money that can cover them. So it's basically an insurance sort of scheme.
It's at the systemic level.
Yes,
we
it's a systemic
need to
level.
rethink how
Yes.
healthcare financing is done.
Whereby I think one of the most important things you mentioned is the gap between the everyday person participating in an insurance scheme compared to, let me say, the corporate community. In Uganda, we still have, let me say, okay, the corporate community is there, but it's still the majority of the Ugandans are like, they're not in official employment. So now that percentage of the people, if they can be convinced to accept and participate in medical insurance policies, then it can be a beginning of tackling to the problem.
Yeah, I think it's a great business opportunity. Natif, one of the people on the docu-series, I think it's episode 4, he mentions it as one of the biggest opportunities that has not yet been tapped into. And I hope someone here, or you, or me, yeah, because I think it's great. We shall have the conversation with Natif next month on 16th. But in terms of pricing, I wanted to share the story of putting this I think it will answer a question also that was asked for employment, like finding work to do or studying this thing, but then there's no money for it. So we shared where the idea of Major came up, and when I finished internship, again, I was lucky. I went for a trip, 40 days in the US, but then I was thinking about what to do next. I could not work in the hospital. And what we did was just continue working on the things that we were working on. I have Mali, I have Major, so I just kept going in them. And these are things that we started without said no budget. There's no budget for Major and all that. So we kept going, and while interviewing people for Major, I got to meet Ian, and now we're doing some really cool stuff. And the Mali Eye work stream too has brought things. So I think what I'm drawing to is that when we study certain things, maybe we think there is a job. Sometimes it's not there, sometimes it's there. And then sometimes maybe when the thing Ian mentions that when people say, I'll follow my passion. Yeah, it's true, there are few people who have the privilege to follow their passion. But I think in the things that you could do, the easy things like Major, you can instead create a path towards the real big thing. It's like your enterprise for selling equipment. It didn't start like with a physical location. It just started with you in like your room and selling to people, and then from that like more things come. It's like just starting. But beyond that, I think there's lots of assets around us that we don't look at. The Major events, that's where I want to bring out the thing of pricing. Most of it has been funded by my family and friends. So it's like, if there is someone here who is here and has not paid, there's someone else who has paid for that. And someone commented on Twitter asking that, when will there ever be, are there any more things that someone can attend for free? Yeah? And I've been thinking about it up to now. I'm like, okay, yeah, people want things for free, but is there anything that is ever for free? It's like there's someone paying. Like, you may not see the person. Like if you're here and like you don't know, like you may not see the person, but there is someone paying. So I just thought about it. Maybe we need to rethink. Maybe it's there in our culture that we look out for free things. I don't know.
It is.
And maybe that's why that we look out for free things or cheap things, and maybe that's why even healthcare is looked at that way. Yeah, because when you set up a hospital, it's like people want to get the cheapest service, they want to get the cheapest tablet, but in one way, either they are the ones paying by taking a substandard service, or someone else is paying. And so it's back to the pricing thing, like who pays? It's not about it being costly, it's like who pays, or is it like the past you who pays for it? Or is it you right now who pays for it? Or is it like someone else, and in a way, yeah.
No, I think that's a very good point actually, because I'll tell you a story. A few months ago, I was contacted by some people from Bloomberg Financial Services. TJ wants to be part of this. No, it's okay. TJ, you can go out. So Bloomberg, and they were doing this investigation into why the World Bank and these financial institutions tended to support IFC. IFC is the International Finance Corporation. Well, you know that. But the IFC is the sort of diagram of the World Bank. And they will do a lot on healthcare, the big healthcare conference and everything, they say, oh, this is healthcare. So when you drill into it, you find that they're only supporting like high-level hospitals. All the hospitals they support in Kenya, Uganda, and stuff are all the hospitals in the city which are like high-level, like Nakasero and ISK. So I agree with them, you know, I'm like, yeah, they talk a lot about it, but when it comes to it, they really want to get their point across. They want to get their interest rate, their interest and their money and stuff like that. So, but then they sent a journalist over here. I didn't meet her when she was over here, and then she went to International Hospital, and she she met patients there and said, everybody said, this hospital's expensive. This hospital's expensive, and then she met patients who complained. A, it was expensive, and B, that she was actually trying to get to that they didn't fulfill the duty of care. So in other words, if you went there with a problem, they would turn you away unless you could, first of all, prove you could pay. And it's a difficult thing for private hospitals, because if you go there in extremis, the duty of care would be, you've come in, you've collapsed, you resuscitate the person, you put them on fluids, and then you have to send them on their way because they say, no, I can't pay anything. Because what had happened, and it happened a lot during my time, but subsequent to my time as well, is people would come into hospital, they would pay a bit, and then they would fail to pay. So they would get into ICU, and then they would just go to bill. Because ICU, it's like, it's just like rocket. And so they'd owe 100, 200, so many million shillings, they would pay like 20 million. And then rather than pay, they would then go to the media, or go to a lawyer, or something like that. And so the hospital was sort of, if they admitted people and didn't ensure they could pay, they ended up with a big problem. But they really got a policy because honestly they were owed billions of shillings. It was like, you're not talking like 10,000, 20,000, hundreds of thousands of dollars. It was just writing off all the time. I know because I'm on the board of the hospital. So eventually they said, this has to stop. We can't, just have people not paying us. And the insurance companies were bad as well. They would also try not to pay, but they could at least have some leverage with insurance companies. But with individuals, especially if the patient died, there was no chance then. And then this thing of holding bodies.
Yes.
So they adopted this thing where they really told their staff, look, when a person comes in, if it's surgical, he must put down 500,000 or have the insurance company. That's why I go back to insurance, because if you're insured, you call up the insurance company, and it's a normal system. In America, there's no way, you must have your insurance. So anyway, this woman came here and got these stories of, it was very expensive, and they turned people away, and blah blah blah. And then went back and did stories on the international media about not so much IFC, but about RSK and about this sort of stuff. I was really so disgusted with them because I thought, how many hospitals can, in the States, it's the most expensive care in the world. You have all of that. Now you come to a poor country, and an organisation is trying to provide care but needs to survive financially. You just get nothing because you hear all these stories. And there's really no patients who will go there and say, yes, it was great, I went there and I had to pay 50 million shillings and I love paying 50 million. But you see that it's coming back to what we said before. You're looking at the humanitarian side, but you haven't addressed the systemic side, which is how do you finance this stuff? I'd say most of the, not most of the care, but a substantial percentage of care, at least 50% of the care in that is financed by insurance companies, by people who have insurance and they can do it. And so I think that you're asking the wrong questions. I've forgotten why we started on this long term. What was your initial comment?
Oh, so the question was bringing back the thing of prices. Because we have people who are looking for free things, and when you're an entrepreneur, you're looking for people to buy something.
Yes. So I think that there's an attitude, and this is why people would complain about having to pay for private care. Everybody wants something free here, and I think it's a really bad attitude, and I do think it's been kind of inculcated by the government, which wants to promise things. The bed's free. When it comes to the investigation or the thing you have to pay for, it even comes to the doctor in a procedure you have to pay for it. So that is wrong, and we need to back up and say, yes, but as I said earlier, 3,000 shillings a day will get you private medical insurance in Uganda. Now, when you go and you have a catastrophic accident and your bill runs to 100 million, you're going to be saying to yourself, I wish I had paid that 3,000 shillings a day, which you could pay. So, you know, it's the way we think about it.
Yeah, and I want to share with you something that happened to me this week. So the Met Gala happened on Monday. I don't know if you guys know the Met Gala. It's this fashion event that happens in the US.
Well, you're
It's
a
about,
fashionista.
I'm not a fashion. I ended up reading about it. So it was like, I was taking a break and then I looked on X and I saw it. So I was like, let me read about this thing. So, and what I'm sharing with you, I read about it and I found out it's about 8 years old, this museum event. And these guys pay $75,000 for a seat for probably 6 hours.
75,000 shillings.
75,000 US dollars. And it's like 600 attendees. And then I went on and read about it, and this year it made like hundreds of dollars in just that one night.
Thousands of dollars.
Yeah, millions of dollars in just that one night. It's probably lasts like 6 hours, and then it makes all this. So I was thinking about it. I had a conversation with my young sister, and then we went like, okay, people spend so much when it's like most of the spending happens at the emotional point. It's like, this is fashion. It's not selling quality clothes or what, it's the sentiment around it, and then you get these millions of dollars from people. And then I was thinking about how can we do that for healthcare? Because when it comes to healthcare, people are now so logical. They are counting every receipt, they are counting everything. But when they go for fashion events, like they're just spending. And maybe that was in the US, but I'm thinking about in Uganda, I think it's the same thing. If you go to points where people are spending emotionally, maybe in a bar, in the church, at concerts, people are spending this money. But when it comes to a hospital, they are not. And I was just thinking about how to leverage that. I don't know, should I go into fashion and then get the money to the hospital? Because that's how human beings work.
I would do as a catwalk model.
Debbie, I will say that for a country like Uganda, I think our priorities are way, way, way different. Looking at the vast majority. Whereas, you know, the US probably that's a prestigious thing, that's showing class, that's how you maybe make up deals and what, but maybe in Uganda, we can just look at how can, if you can get a mutual see someone, an average, you know, someone who's getting money from the garden, someone who's getting money from a border trading, if you can make that person be, you know, willing to spend on healthcare, and maybe what we can talk about is how is that person who is getting, let's say 2K, 20K a day. How?
Okay, talk about the border guy.
Yeah, the border guy. How is this border guy saying, okay, let me make sure I'm insured, such that if I get a border accident,
It's a mindset.
yes, if I get a border accident, I am sorted. I don't have to sell my land, I don't have to sell my border, you know.
Okay, so my comments on that would be two things. One is we first need to look to our own segment of society. So I'll take all of all of us here as middle class, middle income, middle class. Yeah. But if you were to go through the middle classes, and as I give that example, for 3,000 shillings a day, everybody could have medical insurance, and then actually find out how many people have medical insurance. If I were to go around this room, how many people have medical insurance? I'll not do it because I don't embarrass people.
To be
I don't
honest,
think
I
we all
don't.
have it. And you see, oh, Shanta. So the thing is that you know, if we can't address the issues among ourselves, then don't go to the rural farmer and expect him to do it. Because it's a mindset. I spoke to the deputy head, he's really the acting head of Operation Wealth Creation. And you know, we were at this sort of, we were having lunch at some function. And I said, so how's it going? And he says, well, you know, all right, but we didn't address mindset. TJ, you're going to sit there and scratch him. He said we didn't address mindset. By which he meant, you know, everyone was trying to steal the money. But you see our mindset, even, you know, it's like physician heal thyself, or, you know, take the, what the Bible said about taking the speck out of our own eye. if we were to take the middle classes and then say, what's our mindset? People will go and buy a beer long time before they'll pay medical insurance. Then they'll go to IHA, and those are the very guys who will run to the, when they get a big bill, and they'll run to the media and so on and say they've been overcharged and so on and so forth. Medical is a business the same as any other business. Somebody has to pay for it, that's what we say. And I'm really no longer, I'm just very minority in that business, so it's not like I have a self-interest in it, but standing back objectively, always someone has to pay. So you need to address that issue, and that comes back to saying, where it's a society, everything wants something free. We can all talk about the Boda guys, but what about the pharmacists, the doctors themselves, and all that kind of thing? And I think that if we could get this segment of society insured, the 2 million, what do they say? Do they say it's about 2 million sort of middle-income people in Uganda? I think in the national NSSF has got 1 million, 2 million, something like that. But if you say there's 44 million, there must be at least 2 million who are in jobs, there's not, I don't think there's not 2 million people insured in Uganda. I don't remember the statistics, but it's very small numbers. So you start addressing that, and we start to change that mindset. And of course you need to change it with the political classes as well. Because they go into Parliament and the first thing is they say, I want free medical insurance. They get that. And I don't want to pay tax, blah, blah, blah. So, yeah, we need to start with ourselves and then realistic in terms of how we... The other big issue is just the lack of trust. There's not a trust in the system. Yeah, the people don't trust the system.
I was talking to a Boda guy, right? And this man is totally... He has no hope in the system. Be it medical, be it government, any system, and for him, he was like, I am for myself.
That's exactly.
And I'm like, okay, these things don't work. There's no medicine. This guy has had it rough, and you maybe sitting down and think his experience has been so bad. So now such a person, even if they had that DBK to give it, they cannot, because they have no trust in the system.
There's something you said earlier when we were discussing prices, where you said Ugandans have this thing where like they only pay to get, like we have this thing where it's just the services and the transaction, I give you. Like if they come to see a doctor and maybe they are okay, tell them the prescription is rest, and I feel like when you're not supposed to be paying that consultation with anything. So that also is a big thing because now with insurance, if you're paying that week every day for the end of the year, most of the younger people, of course, maybe the most common cause of illness, maybe major illness, maybe accidents. But for the younger people, they may not have hypertension. They may not need to go to the facility every day. So someone who is now able to look at and is like, okay, this 1 million per year that I'm giving for insurance, what if I don't get sick? Like they have that attitude. What if I don't get sick? Why does the money come to that?
It's like you're paying for the future.
Exactly.
Yeah, that's right. And Ugandans are very, very bad at that. But also because we don't trust the system, because we keep pointing fingers at other groups of people as well. So, anyway, give it back to you.
I think we're now full house. You're all welcome for the very first major fireside chat. I like the vibe. I think we should. Okay.
So, is this your cake? It's been handed around.
Yes.
Oh, it's yours?
Yes.
So there is tea or whiskey and cake, and you can get yourself some. So we have some people that came in later. I think we shall do a round of introduction with them. We have a card. The card has a quote for you to read for us, and then there's a question for you to read and answer. The last part of the card is a challenge for you to do sometime. So I'll start with Chantal. Yeah. So you have two cards, so you can choose one of them. First introduce yourself, then you. She didn't get? Oh, she didn't.
There's more cards.
Okay.
Alright. My name is Shanta. I'm CEO and co-founder of our foundation. We do a lot of medical outreaches in rural areas. And I have been mentored by our very own Dr. Ian. And he has
books do not define our limits, actually, that's what I live in, actually. They define our launch pads where we begin in just one chapter in a much longer journey. Great things grow from humble beginnings. Just what it defines me exactly the way I am today. So, do I have to read the question?
Yeah, there's a question for each of you.
What unique strength from your past will you leverage to crush a challenge this year? That's interesting. We all have different strengths in us. Sometimes they're hidden. Mine was hidden. He brought it out. Yes.
I didn't know that. I think Sarah got me more credit than his due.
No, you see, children grow by watching parents. You might have not said or interacted so much with me, but I have watched, read about you, see how you behave within people, and I have learned from that. So I have watched you doing, and I have learned from that. We might not have sat down and you have not mentored me in a physical way, but when we observe people, I think there's a lot we learn from. I know, I've read his books, I've read all his articles, and I have seen him within groups of people. I have seen him do work as well. So that has really helped me build who I am today. And it's true.
But I also say something else. I wrote that column about Rajiv today.
Yes, yes.
But I mentioned a lot in that column. It was a column I wrote today about the death of Rajiv, was you and me. But I mentioned a lot about Sudhir's cousin, Rajiv, Rajiv's uncle. Tushar, but also it was actually Bababai. So Bababai is, we met Bababai, when we first came to Uganda, when we were in Luero, and he ran this forage bureau. And in those days, it was, he'd been running it, I think, the previous 70, and, through the Bogie times, and, he was actually an Indian who never left. He never left, and, so the name of the business was Sekabanji City Fashions. And they did Forex, which they did in a room behind. Okay. And then they sold batteries, greeting cards, and cut car keys. And they didn't have any fashion at all that I'm aware of. But they bought that name, the shop had been on, I think I even met somebody who owned the shop around that, they adopted that name. But Bababai was this, he's an uncle to Sudhir. Yeah, he's an uncle to Sudhir. And he is the most, you talk about examples, he's the most compassionate, most really charitable person you could ever meet. And he had a quite tragic life actually in many ways as well. Quite a lot of sad things have happened. When you say, he inspired me as well. He used to, we would come in to change money, and then he would give us clothes to give to people, the deals of clothes, he'd give us a whole gift. Then he would give us iron sheets for the hospital, or he'd give us money. He's this old guy, we didn't really know him, he's died now. He was one of the guys who was also responsible, there was mass weddings in India. He and Sudhir paid for those weddings in India for people to get married, and then they'd give them a sort of home starter kit as well. I wrote about it in today's paper. But it's interesting now, we do have a business.
Yes, well, that's great. And she mentions mentorship through seeing and just knowing people. It goes back to one of the reasons I started Mejo. So after coming back from Nigeria, I had I think I'm a likable guy, so 200 people took my contacts. Oh my God. The people who came in late, maybe I should recap for them. I'm David. I'm part of the team that works on Mejo. The idea was mine, but there's our team lead is there, and there's a bunch of people working on it right now. So the idea was to influence people to do great stuff or mentor them in a way. So when I came back from Nigeria, I had these, that's when WhatsApp statuses had just started, and I was viewing 200 WhatsApp statuses of people from all over the world. And I was just seeing how many incredible things they were doing, and I would have calls with guys from all over the world. And in a way, it's just like, I was like, just having those people in my life is like a big impact. Just seeing them, and sometimes they would text you and they're like, there's this thing, come and do it. We're doing this. And I think it's what she's saying, like just seeing you doing your work is mentorship of sorts. So we thought part of the, you have to write concept notes for these things. So, but in the concept note for major, we say that we provide virtual mentorship to people by them just seeing the work that people have done. And I hope that goes through here. So we shall go on to the next person. If it's you.
Sorry, just before we go to when Cecilia read her card, she asked about consistency.
Oh.
I think that's one of the ways to get into the spaces of consistent people, because they will talk about their thing every time you have a conversation, and then you wonder, what's the update on my thing? You'll be pushed, and then it's like a very infectious energy. If you spend time with these people, you also your mental framework will evolve just because you're spending time with a certain kind of people. Yeah, so I think you could find the most consistent people and have as many conversations as possible, as often as possible.
They do say that you should always associate with people who are better with yourself.
Yeah.
Either smarter or,
Alright, that's great. So we are going on to the next person, but before I think you guys have your phones and internet. We want this to reach as many people as possible. So if you know friends, there's a link. You can just share the link from our YouTube for people to follow us, and they can also ask questions in the chat. Yeah, you can also take a selfie and show them. But yeah, let's. So that's like you people have paid for this, and then they get it for free. So let's go over to you.
Yeah, thank you so much. My name is Karim Joseph, who was called here by Dr. Makai Kuna. He was an intern. He was an intern doctor when we were in junior clerkship. So we are medical students, three of us from UCD. I'm the president of the Medical Student Association. So he reached out to us and told us he wanted to partner with our association to kind of give back to where he worked from, because he was in Mengo Hospital. And I can say we are very honored to be here. And maybe for personally, for Dr. Clarke, I've seen you, but I've never met you in person. I saw you at Professor Garukandi's 25th anniversary. Yeah, so he's my mentor.
He's a great guy.
Yeah, that's how I know. Yeah, so that's a short introduction about me. On the paper they gave me, the statement is, innovation begins when we dare to question the way things are in healthcare. That courage can save lives, shift systems, and set new standards. Then the question is, what broken system or unmet need are you uniquely positioned to challenge? Identify one sacred core in your field, draft 3 alternative approaches, and test one this week.
So that's the challenge. You can just read that question and answer that one.
So for the question, I think since I'm in leadership and I think it's a current challenge I'm also going through now, the broken system, as you've just been speaking about, is mostly mindset. Changing mindset from short-term and transaction, as he had said, to long-term. Because currently, us in the Student Association, we have a annual subscription fee. And as he had said exactly what he said, that's why I related with this point. Most people want, when they pay that subscription fee, they ask you what's the benefit immediately, but they don't look at their collective effort and the long-term effort of how the subscription fee will help everyone if everyone pays. So we have a select group of people paying and sacrificing for those who are not paying. Yeah, so that's what I'm trying to fix through the leadership.
Alright, thank you. That's great. Our theme for today is create the future, mostly the theme for the entire module. So it's very exciting to know that we have people who are really at the center of creating the future, young people. I'm still young, but yeah. All right. Who else is looking over there? Someone. Oh, yeah, the two girls. Yeah.
My name is Clarke, and that's William. And I'm his vice president from Uganda Christian University. But I'm also on the executive board of the Federation of Uganda Students Association. Uh, my question is, what first step are you willing to take towards the future you want to build? I should think that obviously the first step should be, because I'm in third year, so the first step should be completing my medical school. And then also, and in doing so, along the journey, I should like to complete having made connections with different students in all the different medical schools, which will help me later after graduating. And also, since I want to do research after in the future, so another step would be beginning research training and also forming connections with our professors who are already in the field.
It's great. It's great. That's awesome. But there's some people here in the room who are young people who are doing research. I think they can be a very good help. It's interesting. I've had access to very senior people, and to some extent, my peers have been more helpful than the senior people. It's because I think the people who are my peers are seeing similar things and maybe are closer to the world I'm experiencing than the senior people. Yeah, I really encourage it. In many, for example, Kabunga, Jonathan was in Makerere, I was in Bara, but I think he was so much helpful with the work we did with the Pasemafro than some professors would have done who had all these things like they had. So I think peers are very, very good resource that most people don't see. Over to you.
So, hello everyone, my name is Jahari Tariq. I'm a medical student at Uganda Christian University School of Medicine, and I'm also the MP of the school, so I represent our school in the UCU Guild government. So for my question, it says, if you approach today like a founder, what would you do differently? It's quite interesting because personally, I approach every day as what can I learn, because it's been put into my head every single day that as a doctor you will continuously learn, that you have to always continuously learn. And if I'm looking at it through like a tunnel of a founder, I would say what I would do differently is, instead of looking at what I can learn, I'd probably look for what can I solve. You have this issue and he has this issue. How can I one solution to both your issues? Yeah. So, and then my solution will be more generalizable to the public. So it will be for the older people or for the younger people, males, females, everyone. So I think that's what I would do.
Did you guys talk about this before you came here? Like you have the same school of thought. Isn't it?
I think that's helping yourself.
Similar mindsets.
Yeah, similar message.
I think that goes to be part of how peers influence us. Like we associate with the influence of so like flow thoughts and all that.
That's true.
All right, I think we are done with the first part of the fireside chat. I want us to loosen up a bit. We're going to stand up and take our group forward into the discussions.
There's a bathroom down that side.
Oh yeah, if you want the bathroom, it's down that side. There's water there. You can use this opportunity to get, if you want another cake or, yeah. So, where do you think is the best place? Should we just stay there, then we?
Yeah, let's first try with
Or should we go and take a picture with our poster that says great?
Yeah, the light, natural light.
Okay, I think everyone likes our side. Who has the most expensive phone?
We would go for the equipment, not the phone. That's the most expensive equipment.
Okay.
Nice to see you.
Nice to see you.
How much? I think it's 50.
So, I just wanted you to introduce my wife. Have we lost Mark? I'm in, Robbie. This is my wife. She is your host there. Host through. We live upstairs. And these are all these wonderful young people. Oh, some are medics and some are investment bankers, bakers, that's one person. And pharmacists, and environmentalists. Yes. Medical students. And medical equipment suppliers. Yeah. Lots and lots of, yeah. Nice questions. So this is Robin. I've been married to her for a very long time. She's also an Irish Ugandan too. Yeah. She came with me to the world. Actually, I don't know if you buy that book. I mean, we were there together. That's a different. Because, and if you see, there's pictures of her when she was younger than that. So, yeah.
So you've got more to do?
Yeah. Here's his book. Hold on. There's Robbie.
Weird picture.
That's us.
Actually, Robbie, it shows how you've groomed him now.
Good. Well, I'll let you go now. Yeah. Thank you, Robbie, for hosting us.
Thank you, Robbie.
Okay. All the best. Thank you all. I'm requesting that everyone enters and we conclude the session, please.
Don't take away my tea, I want to drink it. Hillary.
All right, I think everyone is back. So I guess we have had a good start of the half of it. We are going to the last half of it, and this is really a Q&A. I'm not going to be directing anything. The questions will start, and Ian will answer. And if there's anyone who wants to pitch in, you do so. And yeah, the floor is open for the questions. If your question hasn't been answered. Conrad.
Yeah. My question is to Dr. Clarke is about, you talked of there are times when you're supposed to move on with grit and there are times you're supposed to give up. I want you to give us scenarios in your journey. Two different scenarios. Why you gave up and where you continue.
Yeah, it's a good question, certainly. When to give up and when to continue. Well, we all make mistakes, certainly. They say you're supposed to learn from your mistakes. Some people say you don't learn from your mistakes. But life is about trying. And if you don't try, you won't make any mistakes, if you play it safe. But then when you make mistakes and to know when to sort of push through, the sunk cost theory, so you think to yourself, well, I put a lot of money into this, so I didn't get my money, so you keep putting more money in, so you keep putting in, you throw good money after bad. And I've made that mistake in business. And I'm not sure whether I can really answer the question as to when should you keep pushing on and when should you pull back. However, I think a mistake I have made is not to seek advice from people with a very different perspective. So entrepreneurs will tend to be optimists. They'll tend to believe that this thing can work. And without that spirit, you will never achieve anything, because you'll just be waiting all the time and you won't take the first step. But it's also good to hear the opinions of people who disagree with you. You know, the conservative person who says, no, you shouldn't put your money into that, you should put your money into government bonds, you should be conservative, you shouldn't be adventurous. And then try to make an assessment between that. You with me? Yeah. Because, like, if you take, say, your parents may have very different views than you about what you should do. Like, I've seen this with a lot of Ugandan people. In fact, I wrote a column about education, and I think some parents have tended to push the children into what we would call more prestigious or more safe long-term occupations, like the civil service, like government jobs. It's not a good idea. But while you should definitely take into account the perspectives of the parents, you need to have other perspectives as well. And I think that sometimes I've been too rash, too biased. We have a lot of biases. You know, we all have biases. There's good books on biases, and sometimes you're really surprised how many biases that you have yourself. So when you begin to realize your own biases, then it allows you to then get somebody else's opinion, and get the opinion maybe of someone who's quite different from you. Let's talk about investment. I have been better at putting money into my companies and running them myself. I haven't had a very good record of putting money into other people's companies, and that's been successful. And I've done that and actually basically lost quite a lot of money. And if I had been a bit more conservative and listened to more of the financial people who said, in your heart you may say, oh, this is a good thing that I'm doing. Your head may say, but your risk there is really high. You realize that most people should take risks, and they can afford to lose that money. Yeah. There was a young guy I knew. He came to me actually because he took a risk, and then he borrowed from money lenders and all that sort of stuff, and then the risk didn't pay off, and so he lost everything. He really lost everything. And yes, there's risks, but there are risks that are reasonable risks as well. And then if you're going to make a risk, you should also see the sides of it, and then make a judgment, not a judgment just with your heart, but with all the factors taken into account. So somebody asked me once, was I a risk taker? And I said I wasn't. And then that was apparently the wrong answer, because apparently I'm a risk taker. But I'm a risk taker in a more measured way. Let me give you an example. When I rafted the Nile with some people a few years ago. We went down from source to sea. I got on after Murchison Falls, and then I went through Four Rapids and went to South Sudan, and then went through the Sud, and then I came off the Earth, and then went all the way to the sea. Now doing that was taking me out of my comfort zone. It's not something I'd done before. It was a risk, but it wasn't a high risk. Okay. However, the guy who was the leader of the expedition, who's called Hendrik, was an adrenaline junkie. And he put us in risky situations. There was one time when I was I think the oldest guy on the expedition, or one of the older ones anyway. And Henry put us in a situation once where he took us, we went out, we didn't leave where we were staying until midday, and then we ended up in the middle of a bunch of hippos who were quite antsy, they're in the dark at night. I was like, this didn't have to happen if you planned properly. So I was annoyed with him for that. Do you know the sad thing is that guy died? That guy was killed by a crocodile later on. He died. A crocodile. Because he was an adrenaline junkie. He was the risk was a thing that really gave him the buzz. And there are people like that. Now, yeah, that's extreme. And I'm not a person who's just going to put myself in physical danger I've done work in risky places. I've been in clinics in South Sudan. I've been in these places, but it's a bit more calculated, and hence I am still alive today. You can't do everything when you're dead, by the way. But financially, I'm probably much more of a risk taker, and I have lost money because of that. And if I analyse that now, I would say it was because I didn't, realize my bias was this is going to be good. And the thing that I invested in was very noble. It was all good and all that. But yeah, so a financial person, I would say, no, okay, we'll put this much money in, but don't put that much money in. So I think you need to take advice, recognize your biases, and sometimes then you have to pull back. But if I'm talking about the grit and when you have to keep going, if I reference my coffee farm, the coffee farm now is doing well, it's profitable, but it simply wasn't producing enough coffee. It took about 9 years for us to get to a critical point where it was producing enough coffee to pay 800 people, that sort of stuff. So during that time, I knew I had to put money into it, but I just had to put money in longer than I thought. So especially about a year ago, 2 years ago, it was I was putting money in, pulling money from my other companies, and during that time I still have to be the leader of the organisation. I'm not. If I go, oh, I'm under so much pressure, if I break, the whole thing will fall apart. Nobody else is going to believe me. Yeah, shall not treat you in these situations. And so there are times when you just have to grin and bear it, get on with it. You're the leader. You chose this. Suck it up. And then there are other times you have to use your head and take advice. No, that's
I think what he says is, like, he knew whatever he was doing he knew it was a long-term investment, and it might give him some risks. But as him as an investor, he was doing calculated risks. Sometimes we depend so much on our peers, getting information. Like, I'm doing this, and everybody, right now at your age, you want quick returns. The patience he's talking about, running the IHK hospital, running the farm. I don't know how many of you follow him and read his posts and all that. You can see through all the challenges he went through, but it was always positive, and he was looking at longer term goals. Like younger generations these days, you want everything very quick. Today I want to be a millionaire in a year or 2 years. That is everybody's goal. So I think these are libraries where we can actually learn and listen to them, and actually practical things we can take a lot examples.
Well, one of the things actually is, I'll just say it's not related to your question, but I think I alluded to it a little bit earlier. A lot of good things have been done by a group of people who get together, a group of like-minded people who can think through some messages about solutions now, who look at solutions as opposed to problems. I do think more is done by groups of people, and it energizes me to be with you guys. You're all young people, you're all tremendous potential, but I keep saying potential, but that potential needs to be actualized, needs to be realized. And I think more could be actualized and realized if people could find others of their level who would challenge them, and then and maybe you have a business idea or whatever, and then but groups of people. If you look at PayPal, you're still idealistic, and you still haven't actually succumbed to the corruption that's all around us. But no, it's incredible how fast people get seduced. You know, it's incredible how fast people get seduced, because in this country we have an elite, and I don't mean, I mean, there are those who get into the system and benefit very well from it, and if they, that's okay. But then there are those who, you know, they get seduced by the thing, and they lose the idealism and values that you have. So if you can keep your values, realize that, by the way, some of those values are much more worthwhile than financial success. One of the things that we should realize is that our lives are not measured. You know, we said about being transactional. You know, that's Uganda's thinking in transactional terms. The Buddha guys absolutely think. That's why they rob, you know, road accident victims, because they think if I don't do it, somebody else is going to do it. Myself. Yeah. But in actual fact, when you've met the hierarchy of needs, you know, your life is going to be more meaningful if it's more purposeful. You know, and that's not just about making money. Making money is a means to an end. And I'm very happy that my farm is now a surplus, because it takes the stress off me. But I didn't do the farm. I'm going to do this on my mention money, because nobody was in the farm. You know, those thoughts. So to have a purposefulness about what you did, was it you said about? One of you were saying about you getting medical supplies. Was that it? Medical supplies, yeah. Yeah, because you saw a need, you saw, you know, let's do something here, and it has a purpose. It's purposeful to do that. So I think that, you know, the purpose is different for everyone, by the way. And there's stuff that you need to do on the way. I need to train myself to do this, because this is I'm David's been doing a lot of this, you know, whether it's AI or whether it's data science or all of these certain things. But I know David has that sense of purpose. You probably don't even know what it is.
I do. It's why we are all here. It's my purpose.
So I think that's extremely important. But a group of people, because there's David who was his producer, who is it?
Bella.
Bella's there on the guy.
Conrad is part of the team. Hillary.
See the team?
Yeah. So,
yeah, the rest of my kids.
Yeah. So I think I'll just keep it here. People who came in late. What Ian has just done is really the reason we started Major. I thought I was going to write a book at the end of medical school, but then after talking to Conrad, I was like, you know what, making videos is more impactful than me writing a book. It will take years before people read it. But he's saying exactly what I wanted to write. So one of the chapters, I'm still writing them. I'll still publish the book when Major is like very famous and there's like guys who know him. But one of the chapters is about teams. I've done a lot of things, and someone may say, like he's saying, I have a lot of problems, but it's mostly the people that I've worked with. With every idea that I've gotten, I first look around, and then I'm like, okay, do you want to work with me, Conrad? I told the major idea to Conrad over lunch, and he brought it, and he's the lead of the team. So it's like there is a very the biggest potential for human beings is in organizing themselves into teams. I read that like second year mid school, and I was like, okay, part of my curriculum will be learning how to run teams. And it was a little bit selfish, but I got my friends into things. And we had to build them. Yeah, so I got my friends into things, and we had to build them. And through every team that I've been part of, that I've led, I learned something. Because there are different kinds of people. You may think, okay, I've run this team, it has been successful. I'll use this blueprint on every other team that I get. Oh my God, you're in for surprise. So that's like thing that I would encourage anyone to learn, it is how to be part of a team and how to lead a team. I'm not the leader at Major, so it's like an opportunity for me to learn how to be part of the team. My job at the university, I'm part of the university team. I'm like a leader of the thing that I do. I'm a leader of the thing that I do, but I'm also part of it. So it's like you have to learn how to be part of the team, but also you have to learn how to lead the team. Those are two unique things. I know okay, this is a little bit philosophical, but if you've read Yuval Noah, he talks about the human species and what's unique about us. It's not our intellect, it's not our emotions or our ability to create technology. It's our ability to organize complex, big teams. So it's like, it's a whole chapter. I hope you guys read it. But there's a whole episode dedicated to it in our docu-series, episode 5. And for me, it's like the most important. I specifically put it at episode 5 because I hoped more people would be following by then. So I think the team thing is very, very key. Then the other thing is really a question. Is like, if you're like in your 20s or 30s, what thing are you working on that will pay off in like 10 years? I think it's a big question. I think Major will not make any money for the next 3 to 4 years. And it's like us putting in the money, but I think it's very important for people to work on things that won't pay in like 5 years. Because that's when you know it's actually big or like important to be. He gave me a book that I'm reading about Elon Musk, and I'm just seeing like this guy who was just bleeding money to companies that were not making any money for decades. And now they're printing ugly money, like no one has made money like he's making right now. But it's because he's like spent 18 years working on something that's not making us a single dollar. And I think most people don't want to do that, but I think it's very important. And it seems most of the things I'm doing not going to make any money in the near future. But yeah, we're open for the next questions, guys. Yeah, the floor is open. Anyone else? Yes, please.
Yeah, I just wanted to build on that same point, which I just talked about of teams. So I wanted to ask Dr. Clarke, what was your criteria to determine someone to join your team? Because they have just elaborated how the people in your team are very important for you to scale. So did you have any personal values that you look at to read people while they're joining your team? Or,
yeah, that's a good question, actually. I must say, when I was hiring people, and I don't hire many people myself now, but when I was hiring people, I would often look at the person before the job, which is the wrong way around to do it, because usually you have this job. The job has a job description. It has. I've never done HR, obviously, because I get the cart before the horse. The job is certain, job description and all that, and then you look for the person who meets the qualifications and the experience to meet that job. But I think the way I built my teams, you need somebody who's willing. Like if I look at the farm, when we went to the farm, it was a piece of land. It wasn't a farm. It wasn't a farm at that stage. We didn't have a single building on it. But we had to go with some tents. And you sort of, who wants to go down to,
And you say you're a risk taker. After taking tents.
I had to go and find some tent maker, go buy this tent. I went down to the farm with a backhoe, that thing that digs at the back. I think some tractors and trailers and a tent, and a chainsaw and some other tools. And then when you're asking, so I would like to do this. It's like, and I must say, I remember watching a wee guy with a chainsaw and he was walking back, and he was miles of walking through bush and scrub. I just felt sorry for him. It was like really, really hot, and he was sweating. So sometimes it's those who are willing, that kind of context. Charles, who was sort of had to work with me for quite some time. Charles went, and somebody else. You know, like it was a motley bunch in some ways, but it coalesces after a while, and then you get some of the people leave. We had one guy who came, he was quite well qualified, and he knew about coffee, and he worked for a while, but he was one of these chaps who always saw, you know, if I went to go from here to there, he would go by the bathroom and come around. You know the guy, you know people who never see a straight way. So after a while you realize that person isn't fit. Now, what happened in IHK, which is more relatable probably, I would use young people a lot, because I was starting a new thing, and I needed, not a high level position, you know, I needed people who were, what do you call it, front desk, you know, I needed nurses, and lab techs and so on. So I definitely hired young people, and I would hire people that I knew, you know, in the church. I'm just trying to think about it. I even hired people from the pub as well. And not because it was healthcare, but also because they were looking at quite a lot of girls, a lot of women, and they were very, very good. But if you create the, see, one of the things that David does here, and you guys in the meeting, you create a buzz, you create an excitement, you create motivation. It's like, oh, I'd like to join that. You know, that's. So I think it's about motivation, and that's not just about money. So then the people will come along. I had some brilliant doctors join. I mean, Moses Alicante, who's a full professor now. Moses, I don't know how Moses maintained, because he worked with me on the private sector, and he continued his career, and he did research. Thank goodness he's done so much research. and then there's a guy called Marianne Callan, brilliant doctor, and highly talker, you know, like a person with a lot of opinions and stuff. And then there was Rachel McGowan's sister. Rachel's the MP now, she was a singer at one stage as well. But her wee sister, I knew that family, and I knew her just coming out of college, and she started working for me straight out of college. And then she became my HR manager. She now works as a big job in MasterCard. All of those people who work with me now, we're going back 25 years, they're all like women in their 40s and 50s now, and they're all very successful. And I didn't say all of them, but the vast majority of them are very successful. And they get together and stuff, and they say one of them who runs a hospital, she built it and runs a surgical hospital down in Ginger, an American group. And she says often when she would face issues, she'd say, now how would I dealt with this? Maybe because I think out of the box, or because I would put people in the deep end as well. Sometimes I remember I had a clinic down in KBC building, and I worked with another doctor. Then I got cancer. I had a recurrence of cancer. Then that was a hard time actually. Both the cancer and after the cancer, because a lot of my patients have left. Patients don't like doctors who get sick and word goes around and he's dead. So we just started this building up in Old Kampala, and I said to it was Moses' wife, Pendo, who's a wonderful woman actually, Pendo. I said Pendo and David Gallicano, not David Gallicano, another doctor who's working with me. I said, listen, you two, you run on up there and set up a clinic up there. And they were like, what? I said, that's okay, you can do it. And they did, and that's what was the seeds of our the old organisation. So I don't know a formula, but I do know motivation is important, and people being excited about what you're doing, and that's where a team, if you have an idea, somebody has an idea, and you say, hey, what about this? Of course, you need the ability to earn some money, but we are professionals, and we can sell our own services.
Yeah, that's great. I don't know if there are anyone else with that. Yeah. Okay, we have
businesses a lot is the struggle for leaders and founders to have their teams see the vision the way they see it, because to them in their heads it's like this, the potential is so much and the picture is so complete. They see that, okay, if we just take these steps in this sequence, we'll get there. But then getting the people that you're working with to see
follow.
what you're seeing, yes, is such a struggle. And it feeds into how they execute and the grit and the passion and all that. And I don't know if you have any advice for someone who wants to get their teams to see the bigger picture.
Yeah, that's a good question. I am a person who gets an idea, and this has been bad in terms of sometimes making decisions and losing money when you're asking about it. So I would have the idea, I would work it out in my mind, and then I would execute. And people wouldn't see the gap, because normally that's sort of 3 stages. Hey, we've got an idea. Then we discuss it. We decide how it will be executed. We get the plan, and then we implement it. And I would go from idea to implementation in like a day. Robbie, you just had Robbie would say, she says in our relationship, I'm the accelerator, she's the brake. And she says the brake's not working. That I was fast. And actually I've listened to some, you listen to some stuff on Instagram. If you get the right track, you'll get some really good speakers on that. And I listened to one guy who said, I was just faster than other people. If I got an idea, I executed, I went faster. And I think I'm faster than a lot of people who will mull over things and take a long time to make a decision. But it's confusing for people because they say, oh, I thought we were just discussing that. And now he's done it, and that, so you can easily leave your team behind if you're that kind of a person, and a lot of entrepreneurs do it. And as you say, that the people that you're supposed to be with as part of your team are trying to get their head around what you're doing, and you've worked it all out, and you've gone and done it, and then they're like, huh? They're not happy about it. This is not a team. You've got so far ahead of your team. And I've had to be called back. That's why I like Hannah. Little Hannah she would be often the one that they addressed and people say, go tell. Hannah would come on and say, Ian, we have to have a talk. And I would go, okay, what have I done this time? And then you would have to listen, slow down, and communicate properly. Because it's useless if you're not really a team player then, you're just running ahead, doing what's ever in your head. So you do have to learn to listen to other people. You may be the team leader, and as the team leader, you'll get all the praise and all the blame. Yeah? The other team members will, when things go wrong, it's your fault. But when they go right, it's also your, And so I have had to learn to slow down, make sure the team are with me, make sure we've communicated properly, make sure that they all think it's a good idea and motivate. It's not that it's kind of a democracy and we'll all vote on the thing or whatever, but if it's a really harebrained idea, hopefully you'll be able to also listen to people say, you're going to bankrupt us. The person you must listen to most once you get your business going is your finance guy. You must listen to your finance guy. And let me tell you, if your finance guy says, very nice idea, but we can't do it, then you say, all right, let's wait until we have some money. Now, we don't always do that. Leaders of organizations sometimes push ahead anyway. But as a general principle, and as I've got more mature in business, I would definitely always bring the finance person on. That's why you need to be organized as far as your finances are concerned. I just don't think, somebody who says they're an entrepreneur and they have a team and stuff, but they're all over the place as far as their finances are concerned, isn't really a proper entrepreneur. That person's like maybe an ideas man, but and some yeah. Anyway, I'll not go. I could go on about You know, so in other words, your entrepreneur person, the team leader, needs to also listen to other people. He needs particularly to listen on the financial side, and he needs to be able to communicate his ideas back so that his team is also motivated and his team is part of it. We had great fun at one stage when we were in the small hospital. That small hospital it's an Ohana community building. I think there's a school in it. But we were told we had to build a lift, or we need to build a lift. Actually, we got around it because we had a sort of ramp. But so we dug out. The building was on the side of a hill, so we dug out a lift shaft, and then we sort of didn't need it, so we put offices in it. So the executive office was like one level of the lift shaft. It was the most horrible. There was no ventilation around in it. But we used to. My daughter, after she finished university, she did Edinburgh University and she did social history, and she came out and she brought her friends with her. So there was about 3 or 4 of these girls came out, and then they decided that they wanted to have a gap year and work for me. So Lauren was my PA, and then there was couple of other girls who did other things. As I said about young people, and then we had these young Ugandans. And I said Lauren, the biggest contribution that she made to, when we'd had these management meetings, when I was really trying to, we were all trying to communicate properly, was that she made me stop at the donut shop. There was a place, a South African place that used to sell donuts. So she made me bring donuts for the meeting. But it was great, because if you give people the chance to bounce stuff off, they'll tell you stuff. Actually, as a result of that, Lauren and I went on and became a nurse after that. So she's now a cancer specialist.
Wow, that's great. I hope you've been answered. My only addition to that, I think, I also write about it. I think teams are more about the relationships you have with people and less about what you make them know or what you make them do. It's mostly about the relationships. And something that I'm getting around with, I think different people buy different visions at different stages. There are people who I have told an idea, if I even have a name for it, and they're like, yes, let's go. They have seen it. And there's some people who get on when, like, I now have a structure and things are together. And there are some people who get on when you make the first money. They're like, okay, now this thing works. So I think the difference. Yeah, I think the difference at which people buy, and that should be totally fine. And so, which means if you want people to buy the idea, the biggest thing is you making it work. That like whether people are bought or not is like making it work and like keep selling it. I was telling my sister the other day that I think the biggest thing that I do now is like selling. Because like you just need people to get convinced and like keep convincing them. But lastly, he mentioned the book Grit by Angela Duckworth. It has a chapter where she's discussing culture, and she talks about these coaches, I think, of American football and how they cultivate cultures in their teams, and they have these rituals and norms, and they keep communicating it in plain language, and it's on the walls, and everyone recites it. So I think it's something I'm looking out to employ. That's why Create the Future is there on that banner, because it's the culture we want to build. It's what we are communicating as major. Yeah, Jonathan, your question is up.
All right. Yeah. Thank you, David. So,
John, sorry, before you, John, would you like to add something? Because you've got a good experience also in business and running, your managerial projects and so on.
Yes, in my teams, I think what he mentioned is that, like, different people join at different levels. Whether you are doing community services or you're doing businesses, loyalty is one thing which is really important in any aspect. Whether you join a business or a community service or whatever you're doing, even for yourself, try to be loyal to whatever you do, because this is going to be building on what you have as a foundation. Making connections, what he's saying, talking to the right people who carry your vision. I learned started with just 4 workers. Right now, I have a permanent team of 54 medical workers, not students. Wow. And they can join like students. Right now, it's just a phone call, and I tell them we are going here. They'll put everything down and join my team. This is trust, and this is also how you treat other people as well. When you are on ground, I'm not a medical person, by the way. I know zero of medicine. But they trust me to lead them. But when we are on ground, we are all one. We eat together, we sleep, we cry together, and we laugh together. So this is the type of culture. It has taken me 8 years to build on this. Yeah? 8 years to build on this. We have, the way we said, you chase some people away, they are not carrying your vision. But build that loyalty with people around you who believe in your vision. But it will take you time again, the same thing comes in. As he says, continuous, mentoring people, telling them what you really need to be done. But there's a way also you tell people how you want it to be done. So it's very important to build that rapport between the teams and how you're working within yourself. And patience is the best thing, and loyalty, I think, it really, really builds a lot within yourselves. Because as youngsters, I see a lot of youngsters who will like, today you want to go this, the other thing is attractive, now you want to go to the other thing. So build on what you have. As young people, you have a lot of potential. But also I want to ask Dr. Ian about potential of medical people. I read one of your articles as well. Most of them are really struggling to move out maybe and not really capture the opportunities available in Uganda. So how would you inspire them to have the brains in Uganda and not to live and see?
Can I take her question before yours? Well, I think look, I'm fairly philosophical about this because I'm an Irish person who found my home in Uganda, and so I don't believe that you have to stay home. Just because you're a doctor, then you should just stay in Uganda. But it is a loss to the country because the country does. All medical training is highly subsidised, and so when a doctor leaves the country and goes and works in South Africa or Canada or whatever, it's a loss. There's no doubt about that. In mitigation on the doctor's side, I would say that some of the most talented doctors I've known who left, they weren't being facilitated here. And by the way, I don't mean money. They were prepared to stick it out. They weren't, there's one doctor who left, a brilliant and talented pediatrician, and he left. He was struggling financially, but then the opportunity for him in Canada to go on and do highly specialised stuff was just so much more. But then, of course, Canada would be paying him multiple times of what he was paid here. And yes, it's a loss, and I know other people who are, people who are interventional cardiologists, they just don't get the numbers of patients here that they would get if they're going to, it's not like India, and so, so I have great admiration for people like Professor Galakande, who's a brilliant surgeon and a brilliant researcher and researcher. And there are many, but we also lose people. And I can't really blame them because they are going to, if they want to be a highly specialised doctor, they're not, it's harder, much harder. Now, and there's also one of the reasons for building up the private sector here, because then there are more opportunities for doctors. The fact of the matter is that most of the specialist doctors will do some government work and do some private work. And I think that's as it should be. And I think that if we can pay them and they can be around and they're available. It's just getting the balance, where you find some government doctors are really neglecting the government side and doing all the private side.
Jonathan? Alright, thank you. Okay, so my questions are multiple, but the first one is relating to the business in health, the business part. There's this challenge when I was doing internship, I did it in Chito Hospital, and it's a PNFQ. And one of the things that surprised me were the costs for the services. Why it surprised me that around Kampala here, even private hospitals even small medical centers, they charge heavily for surgical related procedures. For example, C-section may be like 1M and above. In Chitovu Hospital, which had consultant gynecologist, the C-section was 300,000. So it puzzled me, like I just couldn't understand how that service was at that cost with all these consultants, MOs and interns and everything, all that structure. So it made me wonder, in your journey as you pursued private healthcare, did you sort of face that competition business-wise, or that challenge business-wise, that it's hard for you to price something at a different maybe price when that same service can be accessed maybe within Kampala by PNFP at maybe a much lower price, which would make you look like maybe you are either cheating this person heavily, like a Ugandan may look at it in that perspective, that oh, that person is cheating, why are they charging me for this amount for this service?
So, price is interesting. Chiwoko Hospital, the one that I started more aware of, and fine. So, but then the government went and opened a maternity. So, but then the government went and opened a maternity centre beside it, because they have this policy of let's have so many hospitals in sub-counties and this sort of thing. And that's a free thing. Now that's good that it's free, but I just wondered why open in competition with, you know, where they already have something there. So there's never a price that people are satisfied with. Like you charge 20,000, you charge 100,000, you know. So it's not just about price as well. It's about the kind of service you give. Now, if you come into Kampala, all the hospitals, if they're in any sense at all, they do, and I know the prices of say cesarean sections and maternity care in Rubaga, Mengo, in Zambia. There's these other private ones that are run by Britannica. Then of course you've got Nakasero, AR Hospital and so on. And those prices they're all sitting in a sort of range. You'll find that in Zambia Hospital is now, actually Zambia Hospital is run by Andrew. He was one of my, one of our doctors. And it's not Andrew who's put the prices up, but all those mission hospitals are now in the city. They're not getting the same subsidies that they would have been getting. So they're running essentially as private hospitals. They depend on the income that they generate. Subsidy, I think, to do it at that price gets quite a lot of, it's actually a great hospital. So, something's to do with subsidy, and but I come back to my same point that somebody has to pay. Like, and even if it's a Catholic hospital, it's in Zambia and it's supposed to be, a church hospital, it still has to meet its costs. It's up to the hospitals then to work out what level they can. If they can do 1 in a million, I think a cesarean section now is cesarean section the care is running about 2 million in Uganda. In Kampala, care is running about 2 million in Uganda. In Kampala. It'd be very a bit up
In
and down.
Zambia it's 1.2.
Yeah, 1.2. It's probably a bit more in Zimbabwe. So, I honestly, I think the issue is systemic. We need to find a better way of people actually addressing the financial costs. Because we have to pay our doctors, we have to pay for disposals and all that sort of thing.
There's a question from...
Just that idea at some time. If I can execute it, I hope maybe someone could eventually could execute it. It's just that on that health coverage, that's some like ideally, like we hope that people's healthcare is covered. So could we also have a way, let's say, we make sure that most vulnerable people in our population have that health cover at that time. Let's say we make sure that all pregnant women have like a pregnancy health care insurance coverage as for that health pregnancy. Like if you're pregnant, make sure you get that insurance for that year, so that anything happens during delivery, you could be covered. I don't know if
like a product for particular condition.
But you see, to spread the risk and to spread the financial cost, you can't have a pregnancy covered because that's going to cost 2 million shillings or 1.2 million or whatever it is, and so you're not spreading the risk. If I take out an insurance for my company, and it's got 50 males and 30 females and some young people, some old people, some children, you're spreading the risk right across.
I just want to just explain spreading the risk.
Go ahead.
What, I know, it's risk, what they call being
risk pooling, but I'm sure you know, I can't really do an insurance for a pregnancy, somebody who's pregnant. I can do a package. I can do a fixed price. I can say we'll charge you 1 million or 2 million. Yeah, this is the service we'll give, and you know that's going to be spread over some visits and all that sort of stuff. It's not an insurance, okay? But when you do insurance, I know if I was to insure everybody in this room, so let's say everybody pays $1 million insurance, he won't use it. So that looks quite healthy. The men probably won't use it much, but the girls will have babies. Some of them will have anyway. So you're sort of, it's risk pooling. You put a lot of money in the pool. If you happen to be unfortunate, and you're unfortunate if you have an accident, you will benefit from that. But you'll also know with women, if you're going to insure pregnancy in a risk pool, if you have like our school, and our hospital was terrible because there was a lot of women, and you know nurses had babies. It wasn't a very good value for the insurance company.
Is that a question?
Yes. I think what I've been getting from here is mainly behavior change and how people can get into insurance and look after themselves. You know, because as most Ugandans are focused on the now, not the future. So, yeah. So I would like to understand your experience working from your book here. I see that you came into Uganda and there was this big epidemic HIV. Yes, I want to understand your experience on HIV and how, because looking at Uganda, what has really helped so much was behavior change to make sure people fear the disease itself, and then even in school we say it's a killer disease. It was involved letters, and it really influenced behavior change and how people look at HIV and how maybe I want to understand the experience working with patients on that, because my village, Pajule, where I come from, I think it has the highest risks, the highest incidence of HIV.
Yeah.
Like in 10 people, at least 7 are sick. Yeah.
Where is it?
Pajule.
I love that.
In Pade.
The accent.
Pajule. Yeah, but people are really sick, and I think I just really want to understand.
So, you know, you mentioned Padera and Pajula and people with high incidence or high prevalence of HIV. It's because it's, you know, when people are facing more immediate threats, which those people did for years and years and years, you know, with Coney, and I think that was the place where they actually chopped people up and boiled them in a pot and stuff. It was really ridiculous. And I think those people are traumatized, and so the risk of HIV seems a lot less than the risk of dying from starvation or Coney chopping you up or whatever. So it gives it brings a certain different dynamic, and it's very, very sad. Now, if I were to come back then to the general population in Kampala and in places that are not so war torn, the government, I think, has made a mistake in trying to say we will provide free education, free health care. It's almost like people don't have responsibility for themselves. And this is particularly applied to men, because women, well, they have these babies. You know, I mean, I just sort of saw a girl today. She was young. She was kind of baby. She didn't look happy, and I thought, you know what? That girl, as we say, fell pregnant. Literally, she got pregnant, probably. You know that, and now she's got a baby, and she's probably, I mean, around in the village, around the farm, you know, 14, 15, they're pregnant. By the time they're 30, they can have about 10 pregnancies. So the women unfortunately have to bear the burden, but the men go, oh, no, government, you know. And the fact of the matter is the government's not able, but if you're an economist, I'm looking at you again. If you're an economist, and you talk to any of the guys that are good economists, you know, there's no way this rate of reproduction that we've got, that we're producing 1.2 million new people in our population, babies in our population every year, to keep up with the services for education and free healthcare and so on, it would be a challenge for Denmark. It would be a challenge for any developed country, big challenge. And I've heard some of those top economists, Jeffrey Sachs and those sort of people talk about it. And it's ridiculous. When we came here, there was 12 million people. Now there's 44 million. And how does any government keep up with that? So therefore, to promise free this, free that, and so on, you're just lying, honestly. You're just deceiving people. But you get a mentality from that, especially men. Okay, I'm not
in the same direction. Why are they acting so weird?
Yeah, it's actually a great sign. I know it's annoying to deal with in the moment. If you're dealing with a writer who's like, oh, yes, who's reacting to your notes as if they didn't write the script at all, that's a psychopath and also probably a bad writer. But John's absolutely right that the irony is all that emotional pain and the response to that emotional pain has nothing to do with making the movie better. And this is where writers kind of start to circle and cycle a bit because the more emotional pain we feel, the worse these meetings and encounters get, which leads to worse interaction, which leads to more emotional pain. And we could even start to become viewed as the D word, difficult. And it's hard because on the front of your brain is saying, hey, they're going to start thinking of you as difficult. But underneath, there's this little blurb saying, kill them. And that's a rough one to correspond. Yes, you will look at it from your side as somebody trying to make some sort of intellectual or angry defense of what they've done, to deny what you're saying, to essentially negate everything you are putting into this. But that's not what's happening. It's just somebody who's terrified that they're about to die and they're trying to stay alive, whether you realize it or not. So, John, how do we do this better for us and for them? Can we get into some practicals?
Let's do some practicals. So let's talk about some do's and some don'ts, and which are almost always going to be sort of opposite reflections of sort of, the natural instinct versus what's probably most helpful at the moment. So let's start with owning an opinion. And so when you have an opinion, you're sharing an opinion, really
and then if you don't pay it, your electricity goes off. Yeah. So that kind of way of making small payments, which start with the solar, I don't know if it's still continuing or not, can be adapted to health. And if you can find ways in which you can get people, but I would say I wouldn't start with it. Everybody thinks I'll go to the boda drivers. I was in a meeting even just yesterday. This guy had this great idea, and he said, "You were in the meeting." Salim Saleh is like having meetings with the boda guys. One point two. Sean and I were in the meeting. And we both know about medical insurance. And so this guy was like, "We're getting really excited. We're going to have this happen. People are just going to pay 1,000 shillings a day, and then we can do small clinics and all this, kiosks," he said. And Sean and I were looking at him and said, "You must be joking." Because, first of all, because of this transactional nature, if I give you this, then I want something back. If you set up small kiosks for, we're just going to treat the simple things, it's the wrong way of thinking, because that guy who's paid us 1,000 shillings will come to your kiosk to get, as Sean said, even if it's paracetamol, there'll be a long queue to come and claim the paracetamol, because he has to get his value. So I don't think we should be thinking about those people. I think we should be thinking about ourselves, because mindset change is going to not happen all at once. People stopping smoking cigarettes in Dublin or somewhere took a long time. But if you can there's a certain critical mass, and there are ways in which we can actually do methods which you're not saying to the boda guy, you pay 1,000 shillings. You might be saying to our guys, look, you can have this medical insurance, you can pay it once a week or once a month or something like that. And there's a company that I know, Clinic Centre, I mentioned it. There's this young guy who... Clinic Pesa. Clinic Pesa. And he's got, he takes small amounts of money, but honestly, sadly, that one has come to, again, they're making money from making small loans, you know, and that's how MTN are making their money as well, from loaning money. Yeah. So we start at home. We start with the manageable group, and then we say what are the ways that we can make it less painless. I'll give you another example. When I was in that interim in about the late 90s when HIV treatment came along, but it was still expensive. There was I think she was a Somalian, she was not Ugandan, woman came along, and she said, I've got HIV, but I don't have the drugs. And at that stage, the cost of a day's treatment was something like 3,000 shillings, you know, it was like $1 a day, it had come down.
No, it's expensive. Huh?
Yeah, it was expensive.
It's really expensive.
But then I thought, that's the price of a cup of coffee. I drink a lot of coffee. That's the price of a cup of coffee. I actually paid for a treatment, actually, because I couldn't see someone die, you know, for a coffee. And that's exactly the same way of thinking we have to get into, you know, that there are certain things that are more important and we can make the systemic changes, and if it's going to be, say, something like medical insurance or the provision of health care, we can start it, and it can even be that it's not slanted toward, sorry, okay, somewhat. It's not slanted toward this idea of we treat the simple conditions. It would be for your accidents. It would be for your serious conditions. Because even in the free health services in the UK, they put up barriers so that people can't just run. The barriers are often you have to wait. You know, you go to get an appointment with your GP. The GP can't see you, so you can go to A&E. You go to A&E and there's a sign that says waiting time is 7 hours. So if you've got to wait 7 hours, you're going to decide, I'll go and get some pricing.
Okay. That's great. Questions?
That's much more of an addition.
Okay.
It may feel like defending. So, of course, among this.
Sorry, before you go, we had scheduled this to end at 6, and I like keeping time, but Ian had offered us more time. That's right. Have 7, and the big people behind the cameras have offered us more time, so we shall be pushing up to 7, a little bit past 7. In case you need to leave, you can leave, but when we are asking questions, let's now try to become more precise.
There was a preacher who used to say, when he was preaching, he said somebody got on the left and he said, no, it's okay, if you get through before me, it's okay, just feel free to leave.
Alright, let's ask the questions.
So, okay, I just wanted to add on what Doctor was saying. Mainly about government and hoodwinking people into not taking up responsibility. The truth is, people who have done internship have gone to those government hospitals. These people can't afford. So, and I think the government somehow, of course, okay, we have a lot of challenges, corruption, what, but they are helping some people. I've done some research on insurance, the community models, what, and people are looking for ways to bring this into our society. But first, the mindset, so awareness. Because there are people, they are insuring cars, we have some life insurance. Medical is a little bit challenging because it's expensive. And as we said, someone will not get sick. Yeah, so those services are mainly limited now to people who can afford. Because if I can't sell any put 1M, because they are more, actually 1 million is the cheap now, like the cheap thing. They are more expensive. So if someone can't put aside 3M for me, because they have other challenges, they have rent, of late education is extremely expensive. So, and I think actually it's not only here, because I watch YouTube videos on USA, and people are saying how to chop insurance, how to do what. So people see medicine, health like a liability, and other things as assets. We call education key, but then how are you going to work? You have finished studying, will you be able to work when you're unhealthy? So the mindset should be changing how we view health. Like you can't make all this money, and you will not enjoy it if you're sick. You see that? Yeah, because it will go. You will lose all your money after getting over cancer, over diabetes, this, we have killing people at Children. So the government can't manage. I think that's why every time we lose this funding from these guys, you say what we really struggle, but we can't manage without those guys. And I think that's where your point was, the price is actually, someone will have to fill in that space. If where government is saying we are getting free what, actually we are getting money from USA, all these other guys with some countries. If we say government can't have things, because right now AIDS, no one is paying for AIDS. Actually, if some colleague was telling me a story where now police guys are even getting people who are selling AIDS drugs. That all these things are supposed to be coming from government hospitals.
Like putting more beef on what you were saying. I feel like vehicles, even the taxi guys, their cars are insured. You know? So maybe, like, still on behavior change, maybe we can think of ways of how to make sure people think this is a priority. Because if a taxi man can insure his small taxi and at a price, I'm sure. So we can think of ways to make sure people prioritize health.
I think I would be interested if out of Major, if out of Major, you could actually start a risk pool, for health, and it could actually spread into other things, because don't forget, every insurance company has got, we've got several things for health insurance, several things to cover. They've got the actual cost, the administrative costs, which are probably 20% or something like that. They're supposed to also make a service, they don't. And then they've got this whole thing of the trivial usage of this card, where the person can walk in and when he doesn't need to go there. And if someone or some organisation did health insurance here as it's meant to be done, in other words, it would not cover you for walking into the clinic because I feel like I've got a headache. You'd have to bear those expenses yourself, but it would cover you for catastrophic illness, perhaps even sending you out of the country. It would cover you for accidents and emergencies. It would cover you for pregnancy, and it would cover your children. If you take this group here, I don't think, have we any children? Any of you guys have children? No, it doesn't matter. I'll assume you don't, there's not many children. But if you were to look over the next 10, 20 years of your lives, you will have children, women will be pregnant, the men will be responsible. They're not going to be irresponsible then. If you started a risk pool, you got enough of you together, and you started a risk pool and kept contributing money, do the value, I would say, of £1 million shillings. If you don't want to do £1 million shillings, then cut it in half, do £500,000 shillings a year, but split it up. You do it every month or something like that. And you can't go for the trivial stuff. You'd be amazed at how much it would become like a cycle, but it would be for the purpose of health, pregnancies, illnesses, and so on. You can then have benefits back. I'll look at the investment banker. You can get you can get her amazing cake at a discount price. But it would be, if you have a big enough risk pool and you have the right mindset, you can actually do the insurance for much, much less, even much less than the £1 million shillings, which I, by the way, think is cheap. That's only $300 for a year. My goodness, in South Africa, you'll pay $200 a month for that. You definitely, and in America, forget it. So I think there is actually a business opportunity here, and it would be do two things. It would change mindsets, because there's a lot of good mindsets about SACCOs nowadays, but it doesn't. I'm not sure how much it goes into the health field. This would be starting from the health, starting from looking after your wives, girlfriends, children, and so on, and you'd be thinking of this long term, and this would build up. I guarantee it would make. I didn't guarantee, but by the time you would have needed, because one of the things with insurance is, if I insure this house, then not to burn down, but to not insure against fire, most of that that is not used to, it's only the occasional house that burns down. So how the insurance companies make money, they take that and invest it. Yeah, so they're making a 10% return per year on the money that isn't used. The problem with health insurance is people use it up all the time. So you don't get that same opportunity. But can you imagine you start a risk pool where you're using it properly, so you're not running and using it up all the time. Then it will accumulate, you invest it, in safe government bonds or whatever, and the thing will grow like a sacco. And then when you need it, you'll still be only paying 500, a relatively small. When your children will need it, you'll need it, or then you have an incentive. People can draw back some money out of that. I'm not the finance person, but it'll give me an idea.
All right, thank you so much. I think I just want to tilt the conversation away from insurance to creating the future.
Here's the future.
Yeah, it is the future. So I think I've started studying this thing around the economy. I think when you come from health side, you're creating business, but looking mostly at the impact of the business and looking less at the economy. But the business is part of an economy. And if you look at okay, I will not say my pattern, but I just want you to give us something to learn from you regarding the global economy and creating a business in a small economy. It's like there's lots of money in Silicon Valley in New York, and there's little money here, but there's lots of impact. I think if you spent $1 million in New York and spent $1 million in Kampala, you'd have more impact with that money. I don't have the statistics, but I feel so. So I wanted you to give us a comment in terms of that thing and the way the global system is set up. And two things that I'm studying right now are credits and inflation. We rarely talk about them, but I've gotten to learn that from the economic side of things, like that's what the guys are talking about a lot. Yeah.
Yeah. Well, I'm not an economist. I'm a doctor. But I'll maybe a coffee farm. Yeah, you mentioned credit and you mentioned inflation. Credit is very, very important in the economy, and it's the thing that's really missing in the economy. It's very hard to get credit. You can get it, but you can get incredible interest rates, which are just crippling. So it's difficult, and inflation kills investment as well. Luckily, we haven't had much inflation in Uganda in the last number of years, and I mean particularly monetary inflation. The exchange rate of the shilling at the minute is 3.650. It's been sitting around 3.650, 3.7, like for what, 5 years, 6 years? Yeah. It's amazing. It's incredibly stable, which is very good if you're borrowing or if you're using. To me, I think it's better if you have that the monetary stability. But I was thinking when you were saying about where depending where money, yes, you're right. You can have a lot more impact here. Shanta and I know that the impact we can have here on the humanitarian level is far, far beyond. The impact I had when I went to the world and the hospital, or what I've done since that time, is far more than I could have had than in Ireland. But there's another thing which I think, David, you have mentioned to me in the past, and I think it's relevant. There are certain places if you want to make things happen, you should go there. So David started off by saying that when he was a first-year medical student, he went to Nigeria, and he made a lot of contacts there, and then he's not stopped since that time, going to different parts of the world. And David is collaborating with MIT on some different projects, and where the action in certain parts, certain things now, the action in digital technology and AI is in Silicon Valley. Now, it can be in all parts of the world. It's more so in Kenya than it is here. But we can make stuff happen here as well. But I think this attitude of being a global citizen is important. We're talking about the brain drain of doctors, but one of the big problems in terms of mindset of Uganda is parochial. It's parochial. People say, well, this is people say, you know, this is how to do things. And there's ways of doing business that business is done in Uganda that is just not acceptable globally. So I actually feel like you were saying you seem to spend time selling things. You know, like you sell stuff. But I do feel that we need to get connected with these sources of expertise and investment capital and stuff, and then, you know, bring them back here where they can have impact. And I was looking at, you know, the laboratories that were set up during COVID. They did a lot of wasn't gene therapy, but genotyping. There was quite a few. CDC set up laboratories, I think, around Africa to do genotyping.
Of the virus.
Yeah, the virus, and yeah. But you know, you find that all the money was in America. It was all in the north, you know. And despite what Trump says about making America great again, America became great under Obama. The interesting thing is, in the 2008 financial collapse, it was really terrible, and it was Obama, for all that he didn't put the bankers in jail, which would have liked to see was done. He actually, America's economy since 2008 has grown. If you look, I keep looking at you because you're a finance person, but if you do the statistics, it's like this big bubble. And European economy, because of Angela Merkel at that time, was like, she was, you know, those Mediterranean countries, we're not going to bail them out. So actually, European economy shrunk. So Europe's economy is like this, and America's economy is like this. And that's all happened since 2008. They were a bit more even before that. So the money is there, unfortunately. I didn't say unfortunately, but that's just a fact. All those technology companies, the value and the money is there swishing around in America. It's not coming here, not even one bit of it. There was a guy I met who wanted to set up a genotyping lab in one of the West African countries, couldn't get one. But he was very well qualified. So we need to make the connections to try and bring them on.
Epistemic.
Yeah. Would you say?
The epistemic humility.
That type of thing, that's the paper he's writing. But yeah, I don't know, like, because you know what we said, we've used the word potential, having potential. But you know, some of that we can't do without, we need the money to do this stuff. So some of you have got to go there. You're going to have to end up doing it. You might end up there.
No, I actually, like I said earlier, I think traveling and reading are really parts of education. My biggest expenditure last year was that 40-day trip in the US, and I think it's because it was like my second time to the US, but reading the books that I'd read, for some old books, you realize that these very bright guys used to like travel to Egypt at some point just to see like where's the civilization going. I think we need more people to go and like, instead of buying a big car, spend money on like a trip to the US. I think because if that is where the money is, we need to sell them something, or we need to entice them to put money here, and you can't do that if you've never been there.
We need to show them what we have.
Yeah, because sorry to get it, but I think that right now the relationship is let's go and beg for money.
Wow.
That's what our governments are doing, which I think is so wrong. I think we need like more. Actually, I was talking to my young sisters, and they were asking me what should I do during the vacation. I told them go and see like what's there. And it's interesting. During my trip, I met this 18-year-old girl from New Zealand, and she was also on a trip like me on the East Coast. I was like, these guys like are doing these things, but we are the ones who need to be doing them more. Because if you've got an idea to implement in Kampala, imagine what ideas you will get when you spend like 2 months in the
And it's the connections as well.
Yeah. And the connections and all that. So I hope in the next couple of years you guys save up some money and go and visit the US.
You know, there's this great imbalance that's going on at the minute. Elon Musk is he's trying to get a movement going where people have more children, because they're not people are not. You need 2.1 children for replacement rate, and almost all countries are below that in the northern hemispheres. I mean, Russia and places like that are way below, but even America is below. Now we have all the children. We have reproduction rate. You know what we're at 3.5. We're at So we're at about 5 children, 5 pregnancies per woman, something like that. Used to be 7. But when I look around this room, I see wonderful young people, talented young people. But nobody knows about you. You see? So if you can get people there who have the money to understand that talent is here, you know, and we can cultivate that mindset and cultivate the talent and all that kind of stuff, then that's where we begin to fit the David doesn't like the quiz. Yeah, so, you know, we need the connections. We need to unlock the talent, as I said. All of you guys need to believe in yourselves. You need to challenge yourselves. You need to go further than you're going. Because, by the way, one of the negative things I'll say about many young people is they're lazy. Why are they lazy? Because they haven't been challenged. You know, they haven't been told to get out of their comfort zone. And they just, when you see mediocrity, you become mediocre. If we're not challenging ourselves to read more, to understand more, you know, the model for our school is inquire, discover, learn. And then the model for the senior school is keep on inquiring, keep on discovering, keep on learning. You know, if we're not doing those things, let me tell you, young people in other countries like Korea, Singapore, Japan, you know, especially Asia, India, they're running ahead of you. They're running away. So this idea that I live in Uganda and it's a nice climate and this is Uganda and this is how we do things, rubbish! Rubbish! It doesn't keep up with the global trends of things. Yeah? But you're different. You're the guys who can change things, they're the girls who can change things. By the way, girls, you have always an advantage, yeah, in today's world, and use it. You know, like I quote. There's a friend of mine who started the company Purifier. You know those word figures? We have them here somewhere. Lovely to see you, Sandra. Purifier. That company. She started it. She started as a student over here. You know, she came from. Where was she? I think she went to Yale or somewhere. But Kathy Koo's her name, and then she married a Malawian guy. So she's now got 2 kids. She's got an MBA. She's got an engineering degree. She's working in private equity at the present time. She's one of the most driven people I know. But to me, she's an example of a lot of Koreans, South Koreans, who are so driven. Now she says they're miserable because they're so driven, you know, they're over the top. But that's, you'd want to see a bit of that spirit here.
Oh, so we are at the top of the hour. We shall be closing up. Ian this is his latest book. It's called The Man with the Key Has Gone. And for today, it's going at 50,000 shillings. And if you want to get it another day, it will be 60.
Well, in the bookshops, it's 60.
Yeah, in the bookshops or. So
but it's a book I wrote a long time ago, and then I revised it completely. And just wrote it better and left out some of it. It's a very easy read. But it describes, it will take you, you read it.
Yeah,
you tell me about it now.
And so I read the book. I think it's a journey of sorts. You travel with him from Ireland to Luwero. For us who didn't experience the Bush War, it gives you an experience of the Bush War and how bad things were immediate after, and then you see how he grappled with setting up all these things, and I think that the elements that he was talking about, grit, you see them firsthand, and how he dealt with all those problems, how he dealt with cultural issues, how he dealt with family issues. There's a little bit of that, and I think it's very, very inspiring for you to get to imagine what has not been there. The first chapter, I think it's about like when he's. Oh, I shouldn't. But the first chapter got me thinking, man, how did this guy imagine that this could become this? Because it's like he comes into this dilapidated house, in a bush. I don't know if you the most remote area you have been, but for me that is what came to my head when I was like, is this remote area, and like there's even no house for him to stay in, but he's like, and it's like he's asking, is this it? Like. And he goes like, yeah, probably it is. And then it starts, and so it's like I was asking myself, this guy had a wife, he had kids, and he could risk this much. I don't have kids yet. I don't have a wife, and like, where's my like risk level right now? So it's like gets you to challenge yourself and really get out of your comfort zone. But one of the key things that I think comes out of there is I think of doing meaningful work. It's really across the book. Yeah, I hope you guys get to read it, and I hope you guys get to use those bookmarks that we have given you.
If I haven't brought enough books, just order it with David.
Yeah, I can get them for the people here. For the people online, just reach out to us on Facebook, on Instagram. The major team will reach out. Pardon? Oh, this, yeah. Oh, yeah, he's going to sign them. Yes, he's going to sign them. He's going to sign them. So this is the book. I hope people get a copy. So right now, I want Ian to give us a closing remark. But before I do that, I just want to tell you guys about Mejo once again. Mejo is a platform that we are developing to support 1 million Africans to have outstanding careers. Our first journey has been getting these stories on YouTube. So we have put out 5 episodes so far. Go and watch them. Go and learn from the 3 entrepreneurs that we have interviewed, and share with a friend. We want 1 million people to get impacted. But beyond that, make sure that you take the step to create the future. Make sure that you challenge yourself. You do something as risky as leaving Ireland to go and stay in the bush in Luwero and start a hospital. Or like push yourself. Ian has told us how much potential we have. Let's dig in and try to do things differently and go to the scary parts of the world. With that, I want to maybe first recognize my team, and then Ian will give us a closing remark, and then we shall go home. Major guys, just come and say hi to the people. The major team, Hilary, Bella, Conrad. Oh yeah, we should actually take a picture. He's coming. They're shy. They're not shy actually. Yeah, so you guys can just say hi or your closing remarks and just wait. Oh, there's a computer. So sorry. He's doing that.
Hi, as stated before, I'm Conrad Makai. I've been the team lead of this work for the last, let's say, 2 years, and we've been that's what, gestation. And then we decided to start the production about 2 months ago. It's about March, and it's been a good process. We're happy that many of you have reached out. Now, platform, just a digital platform. It's a group of friends really coming out to see that a few things have been made. We don't want the traditional way of people in the healthcare space to go through work. We want you to look at different avenues that you can be able to look through and see how you can create a future for Africa. Because we realize that there's a stereotype in terms of the African healthcare sector, and we want to make it better. So the different spaces are very important. And we hope that everyone here, even those who are not into the healthcare space, have been inspired by the entrepreneur, the leader, and the man who came from Ireland to the bush. My best thing from me was we should not keep the Ugandan mentality. The Ugandan mentality is what is keeping us behind. And a lot of us, you can survive on 3,000, that's under $1 in Uganda every day. People survive on 2,000 Ugandan shillings every day. So we are very comfortable to be here. that's not a good place to be. I am the team lead. I'll let the rest of my team. We have a few people who are not here, who didn't manage to make it, who are not in Uganda.
Yeah, it's a global team.
Yeah, so we have the project coordinator. She's a Kenyan, a medical student, a finalist. She's called Stacy Akinyi. Hello, Stacy. We have Victory Moses Peter. He's our person in charge of designs and whatnot. He's also here in Uganda, but was caught up a bit. We have Esther Aiso. She's a Kenyan medical student. She's in charge of social media and the likes. And then we have a few people on the advisory board who are really all over Africa and Kenya, South Africa, and Uganda. And we are hoping that with that we're able to tap into different channels all over Africa. It's not just keeping it here. So in the long run, we shall be able to have such events happen not only here in Uganda. People who could be able to be in other countries. If we can travel, a few of us could be there and see that we can be able to tap into the knowledge that we managed to get from me and Clarke here, the doctor. I'll leave it to these two ladies here to say a word or two, and then.
Okay. My name is Bella Twini. I mentioned earlier, I'm a journalist. I went to school with Hillary and David in high school, and I took the journalism world, and then they went to this field, and they're doing really amazing work. Personally, I am a media innovator. I have created platforms, one of which is a fact-checking organization, fact-check misinformation, health included, climate change, and all of these other topics, current affairs. That's one. And then the other thing that I'm trying to create is keeping indigenous voices or traditional languages alive, because at some point they will go away, and there are some people who will still be speaking those languages and will have to have means of communicating with them. So more of a Google Translate for Ugandans, sort of. Media innovation in its entirety, and how I'm supporting with Metro is just giving a few ideas here and there in terms of media and how to get to the people or what topics to talk about, and I'm excited for the things that Metro is yet to achieve, and the future is bright, and I'm glad to be one of those people who came in when the strategy was there and the lines. So thank you.
Hi everyone. I'm Hillary Nasolo. I'm a pharmacist, but mostly a florist. Lately I do less pharmacy and more flowers. Yes, but with Major I support with disseminating content, and I mainly fit in almost everywhere.
She's the boss for the event.
Yes.
Yeah, she's the one who put this together. Yeah, she's the events lady.
Just for today, I'm the boss.
Good job.
It's great to meet all of you. Thank you for coming, and I hope we can meet again for the next live. Shall we communicating?
It's on 16th, right? With Tony Native next month. So we hope you guys will come. All the people who never made it here will join us.
With a friend.
Yeah. I think, if we have more room, we shall let you guys know. I think that's it. Thank you so much for coming. Closing words, and then we shall close it up.
So I think really I'd like to say I think the day I went to Luaro, to Kabubu, the place, the derelict house, which we sort of fixed up and we stayed in, the night I was there, which was 1 month after I came with my family, I felt I'd come home. I just felt this was home. And I think, I don't know why that was, but I've always felt Ugandans were, what's the word? Well, special in the sense that I'm not being very articulate here. Ugandans have so much they can offer. There's so much that this country, that these people, which is you guys now, can offer, and yet it's so little realised, really, in global terms. And I think that what I want to see is through Mijo, because you want to spread out to like 1 million other people, not just Ugandans, but I suppose I'm focused on Africa, but specifically this is my epicenter. Yeah. I want to see this potential realised, unlocked, and to really see that the world can see what this place can be, and that means you can't go the elite route, you can't go the corruption route. Yeah. You have to go the hard way in the sense of, you need the grit. You need to take yourselves out of your comfort zones, but you guys have it, and just that the world doesn't know about it. I found out. That's why, that's why I'm here. So thank you very much.
Thank you so much. We can close the cameras. This is off camera. Okay. Yeah, Ian and I are building something. You guys know, if you know me, I like building ideas.